Got it. Oh my goodness, people, here we go. Welcome to the first ever hypertrophic cardiomyopathy awareness day. Ladies and gentlemen, it's been a long time coming, and I am really excited to bring you some amazing content today with some amazing partners and some absolutely fabulous HCM warrior stories throughout. I'm going to go through a lot of information in the next 15 minutes before my first co-host comes in for the day, and that will be Milind Desai from the Cleveland Clinic. So what is the HCMA? I figured we had to start at the beginning here. So the HCMA is a 501c3 nonprofit organization. We provide support, advocacy, and education to families, patients, and the medical community, as well as the lay public, regarding all things hypertrophic cardiomyopathy. We foster research and development and treatments for HCM, and it is our ultimate goal to someday eradicate hypertrophic cardiomyopathy. Why was the HCMA founded? That lovely lady that you see there on the screen next to the words is my sister, Lori. Lori died unexpectedly from mismanaged HCM at the age of 36 back in 1995. She was the fifth person in my family to die young from HCM. And at that point, the Jersey girl got a little upset and wanted to do something. And I thought patients needed a voice and appropriate care urgently. The HCMA began as a true kitchen table startup, and today we serve over 15,000 families worldwide. We have so many programs that we have developed out that you're going to learn about today through this programming. This is our first HCM Awareness Day. Next year, it will be, again, the last Wednesday of February, so mark your calendars now. We developed this as we were creating it, so features of the day have been added on as we got a bigger and bigger vision. So think of this as a mini telethon in a sense. So you can feel free to donate at any time throughout the day to support the HCMA's activities, but it's a State of the Union address as well. So here I am 26 years after starting this idea because my sister died and I was sad and angry. And it's amazing what you can do with well-focused anger. Because that's really what started this. People shouldn't die at 36 years old. They shouldn't die younger. They shouldn't die older from unnecessary causes. Like HCM is serious, but we can treat it. We can do something. So that's what the HCMA is really all about at its very core. Excuse me. So I want to take a moment to thank some of our partners, and Bristol Myers Squibb has helped us with a media outreach for today's event. And you are going to be hearing more from them, not today, but in the future, related to issues that they have related to hypertrophic cardiomyopathy and interests they have. We'll talk a little bit about some of these issues later today, but we want to just thank Bristol Myers Squibb for being an amazing partner. I got our media report from our media tour that we did earlier this month, and we've had over 25 million impressions, as I understand it. And that means a lot of people are learning about hypertrophic cardiomyopathy. And we thank them for coming to the cause. On the screen, you're going to see the hashtags for the day. I'm going to ask you, if you're posting on social media, if you're sharing this with your family, please use these hashtags so we can track how effective this effort is and we can make improvements for future years and future events. We want to thank our other sponsors of the HCMA. We have been really happy to have both research partners, and we've had funding sponsorships and program sponsorships from multiple aspects of healthcare industry. So Bristol Myers Squibb, Tenaya, Celltrion, Cytokinetics, Boston Scientific, Imbria, and Invitae. It's their support and funding that help us build these programs that are so integral to HCM families worldwide. So we thank you all, and we look forward to not only partnerships in the future with these organizations, but we are developing partnerships with other organizations that will help us in our endeavors as well. And if you're one of those people that we're going to be talking soon, this is what we're all about. So this is kind of my how we spend the money that we work for so hard to help patients with HCM. So thank you all. What is hypertrophic cardiomyopathy? Well, I'm not going to give you a deep dive education on HCM today. I'm going to show you 2 slides as we start the day. The first slide is the various anatomies of HCM. And if you look over to the side of the screen, you'll see normal hearts and you see normal thicknesses and normal chamber sizes and normal left atria and mitral valve. As you look at the different presentations of HCM, and these are just a few of the possible anatomies of HCM, you notice that the walls are thicker in some regions, some up high, some down low. Doesn't matter where the thickness is. It matters that it is the appropriate thickness, 1.5 millimeters or centimeters or more in the free wall, in the apex, in the septum. So anywhere in the ventricle, it can be thick. It can be thick equally. It can be bubbly. It can be asymmetric. It can be a lot of different anatomies. You may not have a lot of thickening at all, but very abnormal mitral valves or papillary muscles. These are all within the spectrum of hypertrophic cardiomyopathy. Today, we're going to be focusing mostly on sarcomeric hypertrophic cardiomyopathy and not the syndromes and other disorders, other genetic variants that can cause HCM appearance, such as Danon disease, Fabry's disease, amyloidosis, sarcoidosis, and others. We're going to be really talking about the sarcomeric HCMs today, not that the others aren't important, but it is the majority of our population that have anatomies that look like this. The others are very rare. So what do we want you to know about HCM? So I did a population count this morning just to make sure that I had the latest breaking population of both the United States and the world. HCM is a common genetic disorder impacting between 1 in 200 and 1 in 500 people. That is regardless of age, ethnicity, gender, or geographic location. So that means if we're on the high end of that, the 1 in 200, that's 1.6 million people in the United States and 3.9 million people worldwide as of population counts of this morning. HCM is commonly misdiagnosed as an innocent murmur, asthma, anxiety, being out of shape, or depressed. HCM runs in families and is a dominant genetic disorder. However, I think it's critically important that we all understand that at this time, we only have about 40% of those who test positive for a known causative mutation. That doesn't mean those other people don't have hypertrophic cardiomyopathy. It means we don't know the gene that's causing it or the genes that are causing it or what other factors might be causing it. So we still continue to research. HCM can cause a wide variety of symptoms and severity of symptoms, including shortness of breath, chest discomfort, lightheadedness, fatigue, palpitations, brain fog, passing out, dizziness, and a combination of all of the above. HCM is also a leading cause of atrial fibrillation. And thereby you should be thinking, why AFib? And it could be HCM. HCM is a leading cause of sudden cardiac arrest in the young, and sudden death can occur without any appreciable symptoms prior to the event. So risk stratification is critically important. There are many treatments for HCM and sudden death prevention. There are surgeries, there are implantable devices, there are medications, there are catheter-based procedures, and in the most severe cases, there's heart transplant. So there is a way to treat every aspect of HCM in today's world. So the HCMA established its HCMA Recognized Center of Excellence program around 20 years ago. I can't tell you when we first started using the term, but it's about 20 years. And this was to help patients receive appropriate care for their HCM. And this program has now grown to 43 programs in the United States with others in development. And you'll see a list of the cities and states and countries that we're talking to right now. This is the biggest call to action today, people. So thank you so much for being here. I'm really excited about this day. But there's good news and there's bad news. Currently, there are under 150,000 patients currently with a diagnostic code for HCM in the United States. That means that less than 15% of those with HCM have had the opportunity to be diagnosed. That leaves 85% untouched, at risk, and maybe suffering unnecessarily. We have a lot of work to do to solve these problems and find the undiagnosed. And we have strategies that we are implementing that will help us do just that. We have some amazing partnerships we're going to tell you about today. We are not just sitting here as patients waiting for the world to change. We are patients changing the world together. And you're going to meet some amazing people today. I'm really excited to introduce you to all of them. Have I mentioned I'm excited yet? This slide is very important to me and very meaningful. I dedicate today's event to the memory of Mr. Claude Brady. He was the first patient ever diagnosed with hypertrophic cardiomyopathy in 1959. This is a copy of the letter. I was going to hold up the actual letter, but it's behind me and I forgot to grab it. Maybe I'll show you later. But he gave me that letter, the original letter of his diagnosis, when I had lunch with him or dinner with him on June 26th, 2020. It was the last day I got to spend with him. Claude left the world on January 25th, 2022, so just a couple of weeks ago, at the age of 84. The fact that the first patient with HCM survived from 1959 to 2022 is extraordinarily inspiring. He was my personal hero, and you will hear me use the term in the future, be like Claude. Let's do this like Claude. He lived his life in spite of HCM, in the face of HCM, and after HCM. So God bless you, Claude. We miss you. I am wearing the pin you gave me, and I'm thinking of you today, my dear friend. So I'm going to take you through the agenda for today quickly. Oh, sorry, my mouse is being wonky. You had my welcome address. It's almost over. We're going to have Centers of Excellence popping in this morning to say hi. Some of them are pre-recorded because they have issues that they couldn't be with us live. Others will be with us live, and some of them will be both. Then we're going to have a keynote address from the big guy, Dr. Barry J. Marin. He'll be joining us at 3 o'clock. Can't wait for that session. Oh, I forgot to update my slide. So we are going to have, I'm sorry, this is out of order. I will throw one up later. Not that we're last minuting this or anything, but we have Cytokinetics, Chennai, our discussion group leaders, Imbria, Celtrion, the American Heart Association co-branded materials, people from the Faces of HCM, and we didn't get to do the quiz, so forget about that. There won't be a quiz. After that, we're going to be joined by some of our committee members of our legislative subcommittee, some friends from Women Heart, and then we're going to talk to you a little bit about the Lori Fund, and we'll hear from our board chair, Amit Kalia. And then at 7 o'clock, I got something big coming, and I'm hoping that you'll all pop in and out throughout the day, but come back around 7 o'clock, 6:30, 7 o'clock, and hear some big announcements. So lastly, before I kind of pivot off to my dear friend from Cleveland Clinic, I want to please remind you that the Elizabeth T. McNamee Foundation is offering a matching challenge for today, for the month actually. So they'll match up to $10,000 in funding. So if you want to make a donation, now would be an awesome time to do it so we can double your money. So please consider participating in the matching challenge. I am going to go back here for a real quick second because I forgot to bring something up over here on the side of the slide, which is very important. If you're going to watch us on Facebook today, you're going to see this frame around pictures and individuals telling their own story in their own words that have allowed us to share them on the HCMA page so that they will get a little bit more visibility. In addition, you may have followed throughout the month, we are having our Warrior of the Day campaign. So you can follow that on social media as well. But I wanted to thank Eric because we created the frame and some people who were technology challenged didn't know how to put the frames on, and Eric stepped up and did it for the community. So thanks, Eric. Okay, sorry, wanted to do that. Teamwork makes the dream work, people. Not only do we have amazing industry partners, but we have amazing advocacy partners. And you're going to hear from some of them today. You'll see some of them behind the scenes at the HCMA. And it is truly an amazing heart advocacy community that we belong to. It's not just HCM. There are people fighting other battles. But when we fight together for change to help people live better lives, we all win. So thanks to all of our partners. I really love working with you all. And now we are going to talk about our Center of Excellence programs directly with them. If you want to learn more about the HCMA Recognized Center of Excellence programming, I encourage you to look at the website, and I'm sure one of my staff can drop a link into either Facebook and or the chat here, and you can learn more about what the programs are and who they are. So lots of logos here, people. I don't have time to name them all, but we thank them all from the bottom of our thick hearts for all that they do every day for patients. These are the new programs that we are talking to. We're not naming the individual programs themselves, but only the city, state, and country. So this is what is on our desk to get accomplished over the next few weeks, months. And we are actually currently evaluating much more efficient ways to onboard more programs in more of a curriculum-based structure. So if you're one of our centers of excellence in pending or for evaluation or consideration, and we haven't gotten back to you yet, we're working on better systems. So we thank you for your interest, and we look forward to working with you all in all kinds of different parts of the country and the world. And now we're going to hear from Dr. Milind Desai.
Hello, everybody, and thank you for joining and giving us this opportunity. I'm Milind Desai. I'm a cardiologist at the Cleveland Clinic within the Heart and Vascular Institute. I'm also the director of Hypertrophic Cardiomyopathy Center at the Cleveland Clinic. And it is my great pleasure to introduce you to our program as well as key members of our team. So as you probably know, Cleveland Clinic has out in taking care of these patients. A key strength of our HCM program at the Cleveland Clinic is that...
My apologies. It appears we lost audio for a moment. I'm going to replay a little bit of this talk so you don't miss anything.
Take care of these patients from a clinical perspective. They are Doctors Maren Thamilarasan, Dr. Zoran Popovich, Dr. Boju, Dr. Michael Emery, who also happens to be a sports expert in sports cardiology. These are the key members of the HCM team, but there are others who help out in taking care of these patients. A key strength of our HCM program at the Cleveland Clinic is that everybody who takes care of HCM patients is an expert in advanced imaging techniques, including many of us who are experts in multimodality imaging. That brings a unique strength to the program as it relates to taking care of these patients. Of course, we are backed by the most comprehensive and the largest echocardiography laboratory in the world at the Cleveland Clinic, which helps us take care of the full spectrum of echo-based imaging as it relates to hypertrophic cardiomyopathy, including stress echocardiography. And along with echocardiography, as most HCM patients know, cardiac MRI has become a very important element of your diagnostic algorithm. So Cleveland Clinic, we have a large cardiac MRI program which offers the full spectrum of imaging as well as research related to that. Similarly, for some patients who may need cardiac CT or cardiac PET nuclear, we have top-notch programs also in those arenas. Some of them are world-leading programs. We are also very fortunate to have a world-leading cardiac surgical program, including two of my fantastic colleagues, Drs. Nick Madeira and Doug Johnston, who are experts in the surgical management of patients with hypertrophic obstructive cardiomyopathy. And we take care of some of the largest volumes of such patients in the country and perhaps in the world. Now, there are other key key elements to our HCM program, including our large hypertrophic cardiomyopathy-related electrophysiology program. This is, again, the largest such program in the country, and we provide the widest spectrum of management possible in patients with HCM. This includes all forms of complex management of atrial fibrillation, devices, dealing with complications of devices, lead extractions if somebody were to need it, leadless pacemaker, etc. Our interventional cardiology program, led by Dr. Krishnaswamy, as well as our chairman, Dr. Samir Kapadia, also provides a tremendous bit of expertise in alcohol septal ablation, including my colleague, Dr. Grant Reed. So the three of them provide us with solid alcohol septal ablation backup. Of course, we have a broad cadre of genetics capabilities, including expert genetic counselors who provide every aspect of care from a genetic perspective that is required in these patients. Patients. The mantra of the Cleveland Clinic is patients first. And of course, we would sincerely like to thank all our patients for trusting in us with regards to your comprehensive HCM care. I would also take this opportunity to sincerely thank the HCMA and Lisa Salberg, along with her team, for being tireless advocates for such patients, ranging from providing them with access, advice, advocacy, and basically being there for these patients, for you patients at your most vulnerable time. So I truly cannot underscore the importance of your HCMA's advocacy. And I must congratulate you for getting to where you have gotten today. Another important aspect that I would like to highlight of our HCM program is our tireless educational efforts. We are involved in all aspects of education, not just patient-facing, but also other physician-facing programs, including our call rounds, our consult QD articles, scientific presentations at national meetings, as well as Cleveland Clinic sponsored CME programs. The most important aspect today and beyond in hypertrophic cardiomyopathy is the exciting research that is going on. And I am very proud to say that Cleveland Clinic provides the full spectrum of research as it relates to hypertrophic cardiomyopathy. We have our large institution-based registry, which does a lot of cutting-edge research. We have our large surgical research program, but more importantly, we have access to all aspects of new precision drug therapies that are being currently tested in clinical trials, including leading randomized multi-center trials. We are also involved in HCMR, which is a large National Institute of Health sponsored registry, which takes into account a lot of imaging as well as genetics and biomarkers. This is gonna shed a lot of important light in case of hypertrophic cardiomyopathy. If you are a patient with hypertrophic cardiomyopathy, there's no better time than now to be a patient, because of all the advances we made in understanding of the disease, the genetics of it, the imaging of it, the procedural outcomes, all these registries, all these clinical trials that are going on. So this is no better time than right now. So an empowered patient, an educated patient it's very easy to be an empowered and an educated patient in 2022 and beyond. And I would urge everybody to take advantage of all the opportunities of education and understanding that are available, not only for you, but also for your family members. From a Cleveland Clinic perspective, if you want to come see us, What we have also managed to do is refine our referral process. So we have, of course, you can reach us through our website. We have now a dedicated email, which goes to a dedicated group of support staff that takes care of these referrals pretty much immediately. We have our resource nurses, wonderful resource nurses that help ask questions or help answer questions related to your upcoming visit. And of course, we have our surgical referral process for folks whose referring providers need that, who realize that they need surgery. And another important venture that we have started is our second opinion process. So if you are a patient who cannot make it to see us in person, we can offer virtual visits or second opinion visits. And I would urge everybody to take advantage of that if that were to be the case. Thank you so much.
So I understand that somewhere in this room is Milind Desai.
Hi, Lisa. Hello, everybody.
Somehow I just have you on audio. You're talking from the heavens.
It says the video, the host has stopped my video. You are so.
I did that?
Looks like it, but.
Would one of my staff please unstop his video and let him video? Because I'd like to have somebody else's face on the screen with me. So we'll try to get to that. But Milind, thank you so much for joining us today. I know you're really busy. That's why you sent the video ahead and then you decided you could join us for a few minutes. So I don't know if you have any other points that you'd like to bring up on HCM Awareness Day.
Thank you, Lisa. Yes, I am on call and inpatient round, so I did not want to stand you up at the last moment, but I still managed to finagle some time. Sincere thanks to you and your organization for what you're doing. And I truly meant every word of what I said to the patients. There is no better time than right now. Look, it's never a good idea to be a patient of anything, but if you happen to be a patient of something like HCM, there's no better time than right now to be the patient because of all the good things that are happening in the field. The education piece, the advocacy piece, the research piece, the imaging piece, the surgical piece, the procedural piece. So you know, this is the time. And thank you for everybody. Perseverance and thank you truly, Lisa, for your passion and constant. You know, you keep us on our toes. You know,
that's the job.
You keep us on our toes, and that's the best thing that has happened for these patients. So and lots of good things are coming down the pike. So thank you again, and you will see my face sometime later, but right now it's okay.
Yeah. Yeah, sorry about that. I don't know what happened with that part, but hopefully we'll fix that for the next one because I really don't feel like looking at myself all day. So I wanted to give a nod out and an acknowledgement to my original contact at the Cleveland Clinic, Dr. Harry Lever, who does join me now in podcast world. And you can catch us on Tales from the Heart every other month now live on Friday mornings. But you know, Harry set the landscape at Cleveland Clinic for true excellence in clinical care. And you have taken on the torch and you're carrying it to the next generation. And I say thank you to that. And even a flashback to the days of Doug Lytle doing surgery on so many of these patients and training Nick Smedera. And it's wonderful to see the evolution of programs over time. And I can't wait to see what's coming next.
Thank you. Yes, absolutely. It is about expanding the pie and it is about moving the field forward. And there's no better time than right now. Thank you so much, Lisa.
Thank you, Milind. And we're going to get off to our next guest. So I have to figure out, you're going to have to all give me a moment here to pause because we're having a technical difficulty, I think, because the panelists should be able to come in and be a panelist and they should be invited to, oh, you know what? Maybe it's me. Maybe it's me. Okay, so next up we have Sara Saberi. Dr. Sara Saberi, where are you, my dear? I just saw your name. Okay, I'm going to, whoops, hold on one second there. I should be able to, Someday we're going to figure out the technology here, people. Here you are. More. It's not letting me go to the to make your camera show up. Ask to unmute. Oh, I might be to blame here. Ask to unmute. And one of my team is going to have to call into Zoom support and ask them for some help on this, because for whatever reason, I'm just going to pop you. Oh, what happened, Sara? Did you pop in there?
Yes. Well, I'm here, but it says that it can't start the video camera now. I don't know why it can't start. There
it goes.
Oh, there we go. Okay.
Hey, welcome. Welcome to HCM Awareness Day.
Thank you. It's good to be here. All right, there. Instead of seeing my office, I'm also on inpatient service and rounding like Dr. Desai. So everything's kind of crazy right now. Well, it's good to be here. Thank you so much for the invitation. I'm Sara Saberi. I am the co-director of the Adult Inherited Cardiomyopathy Program here at University of Michigan, and have like the distinct honor of working with a really awesome group of physicians. I'd like to it's hard to follow up Dr. Desai and the Cleveland Clinic, but I do think that we have a great program, a lot to offer. We've been working with the HCMA for over a decade now, longer, for I think something on the order of about 15 years in patient advocacy and really pushing the field in terms of the delivery of excellent care. And I've always been grateful for Lisa's guidance and her pushing us to be the very best that we can be in the kind of care that we deliver to our patients. Ultimately,
thank you for that partnership. We love it.
Yeah, it's been helpful all around. Ultimately, our patients are our neighbors, and they are friends, and they are teachers of our kids, and people that we run into in the grocery store and have play dates with. They're our family and our community, and that's the approach that we take at University of Michigan, is that you're not a patient with HCM or an HCM patient, which actually is very irksome to me when people, because you're not just HCM, you're a whole person that happens to have this disease process. And just as Dr. Desai had said, there probably is no better time to have this kind of disease process if you are going to have something be, as there has been so much advancement in the science, not just of the disease process, but also, I think very importantly, in how we deliver care appropriately. So we have both an adult and pediatric inherited cardiomyopathy program. So we not only treat hypertrophic cardiomyopathy, but we treat a whole host of inherited heart muscle and arrhythmia disorders. And we're a pretty integrated team. So we do monthly meetings where we discuss kind of difficult cases and essentially get second opinions for our patients when we're not really sure what the diagnosis is, or we're not really sure what the next treatment step should be, or we want other voices at the table to make sure that everything's going in the right direction. And that involves, our pediatric colleagues, Dr. Mark Russell and David Peng, and who are the primary pediatric cardiologists, as well as electrophysiologist, Dr. Bradley, our cardiac MR and imaging specialists, Dr. Jimmy Liu and Adam Dorfman, and then the cardiac surgeon, Dr. Oye. And then on the adult side, there are three of us, adult cardiologists, Adam Helms, Eric Smith, and myself, and we are growing. Dr. Lachimsetti from EP, Dr. Pagani and Alawadi, the cardiac surgeons, and our adult radiologist, Dr. Agrawal. So we consider ourselves, as in terms of physicians, to be really a seamless kind of organization that's here to serve you. And our genetic counselors actually bridge both the pediatric and adult services. Patty and Rajni know all of our families, know the kids, know the cousins, know the aunts, know the uncles. And so the transitions from the pediatric team to the adult team actually end up being quite seamless because everybody knows everybody, which is how we like for it to be. We also, like the Cleveland Clinic, can provide a whole host of services, everything from general cardiology, because, coronary artery disease is pretty common, and nobody with HCM is immune from coronary disease. So we consider ourselves cardiologists first and foremost, and then HCM specialists kind of secondarily. And so we focus on kind of whole person care. And then there's, stress imaging, stress echo imaging, nuclear, all the same services, basically. I'm not going to belabor the point, but there isn't a service that could be offered somewhere that we wouldn't be able to offer to you here at University of Michigan. We consider research to be really important and integral part of the care that we deliver. So we've had an institutional registry that was started back in 2005. And we're one of the founding members of the International Share Registry and continue to participate in that, where we now are able to follow something on the order of 10,000 patients worldwide, and have learned a lot by being able to see the disease process in the real world in contemporary times, as opposed to maybe what we were observing 40 or 50 years ago. And so we're proud of the contributions that we've been able to make to our understanding of the disease process and all the ways in which care delivery has improved and still has room for improvement in the future. We are proud to be able to deliver research from a bench perspective, so very kind of molecular level of investigation on trying to understand the disease as it involves the cardiac muscle cells, because it's that understanding, kind of the understanding of the genetics of the disease, that then helps inform how do the proteins in the muscle cells not function normally, and then allow us to have drugs that are currently in the pipeline to be able to actually target those abnormalities in the protein function to allow, for the first time ever, drugs that actually target the disease as opposed to target every other cardiovascular disease, and we just happen to use them for management of HCM. We also participate in clinical trials. So I'm happy to say that we have been one of the few institutions that has participated in the clinical trials of the myosin inhibitors from the very start, and continue to be involved in all of those trials, both for patients with obstructive disease and non-obstructive disease. We participate in the trials for Novartis in terms of non-obstructive HCM and device therapies in cardiac surgery techniques, in non-surgical but invasive techniques in management of outflow obstruction and atrial fibrillation. So I think our research here is really focused on attacking the disease process from every kind of aspect that we know how to. And just like Dr. Desai had said, we also focus on education. So we spend a lot of time with patients in clinic. Our new patient visits are about an hour to an hour and a half long, and that's with me. It's not with somebody else. So you get all of the information that I know about you, and I make sure that you understand your disease process, that you know your ejection fraction, that you know what that means, that you know what outflow obstruction is, that you understand the genetics. You spend a lot of time with our genetic counselor, just even starting with the basis of what is DNA. And we think that kind of information is important for you to have. And we address those things continually over time, because one new patient visit where we throw a bunch of information at you is really overwhelming. And so we really do focus on that kind of education. We focus on exercise education. We focus on nutritional education, your mental health, offering support groups for everybody from young adults who are undergoing ICD implantation, because that's a big undertaking and a lot to take on, to young women who are in their reproductive stage of life and trying to make decisions about how to proceed with pregnancies. And we actually offer a very comprehensive pregnancy care program, and work closely with our cardio-obstetrics team, anesthesiology, and maternal fetal medicine team, so that we are, again, kind of a seamless program that can deliver care to our patients at every stage of their life. I think that's really all I have to say. Thank you so much for giving us time. Yeah.
I think that was a lot. Sorry, you said something early on in your comments, and And I want to just double back on that for a minute, because I try to explain to inquiring programs what it is to get involved in this community. It's not a patient that you're going to see once in a while. And, maybe for 15 years or 20 years, you follow that patient, and that's a lovely relationship. But this is family, and you get to know their family. They get to know your family. I mean, we've watched young doctors getting married, having babies. Their kids are going off to college now. And we're here as the patients watching your life evolve. You're there on your side watching our lives evolve. And there is a connection in our community. And no disrespect to other forms of cardiology, but it's special. It's really special. And
yeah, I consider it an honor. I always, when the cardiology fellows come to me asking about, what I do and trying to kind of formulate their niches and what their lives are going to be like, I always tell them what an honor I feel it is I'm so lucky to have found my way into Dr. Day's clinic when I was a trainee as a cardiology fellow. And she was so enthusiastic and warm and had such amazing relationships with her patients. And that was really, to me, it was like the best way to be able to be a primary care provider for a group of people, not just the patient in front of me, but their entire family. And it is, to me, really one of the most satisfying kind of parts of my jobs is that I get to know my patients and their families, and I see different family members at different times of the month and get to hear about what's going on. And they all know me, They're like, oh, how old are your kids? My gosh, I remember when you were like pregnant out to here with him, and now he's 10. And I think that these relationships are really important. And I consider myself really to be very fortunate to be where I am.
So it had COVID not happened and we were able to take our Big Hearted Warrior tour on the road, I actually envisioned it to be a very different kind of medical conference, because I see our HCM physician partners, nursing partners, PA partners as the rock stars. And I wanted to put up these little stages with, shimmering lights and rock music as you guys come up on the stage, because, people can have heroes in all kinds of walks of life, music, sports, whatever. Yeah, that's fun. But to be able to say that you make a meaningful impact in people's lives, not for a day or a week or a month, but for their lifetime, makes you guys all rock stars to me. So I think you guys are amazing. So thank you for everything that you guys are doing there. Thank you for being part of HCM Day. You're getting a lot of shouts out in the chat. You might want to go check that out. You got some lovely stalkers here who are fans. So go say hi.
Everybody has a wonderful day and a great experience. I'm happy to partner with you anytime, Lisa.
Likewise. Thank you, Sara. And we are going to go from Michigan now to New York State. And we have Dr. Bipul Baibhav from Rochester Regional who'll be joining us. And Bipul, welcome to the HCM Awareness Day. Thank you so much for being here.
Thank you, Lisa, and thank you for having me today. And I really thank the HCM community and the HCMA for this great opportunity to discuss our hypertrophic cardiomyopathy program, and also to raise more awareness about the HCM patients. We are located in Rochester, New York. So this is not Rochester, Minnesota. We are around 300 miles from New York City. I
do have some slides I can pop up. I think you sent me some slides, didn't you?
Yes.
Okay, let me put those up on. You can keep talking. I'll just do some back work here.
Okay.
There you go.
Okay, so we are in upstate New York, between Buffalo and Syracuse, and we are in the beautiful Finger Lakes area of New York State. We are located in Rochester, New York, which is a medium-sized city. We are part of Rochester Regional Health, and we have around 9 hospitals in the Rochester area, but also some in the St. Lawrence region in upstate New York. We have a big cardiology practice with around 50 cardiologists. I joined Rochester Regional in 2016, and my background is in cardiac imaging. So I do cardiac MRI, cardiac CT. I'm also the director of the Advanced Cardiac Imaging Program. And when I started out here, I felt the need to have a HCM program in this area. Many of our HCM patients had to travel more than 300 miles to get to a comprehensive HCM center. We also felt that we could improve care for our hypertrophic cardiomyopathy patients in this region. We started that program in 2018, and currently we follow around 350 patients with hypertrophic cardiomyopathy in this region. Lisa and the HCMA has been very good in guiding us through this process and really helped us with raising awareness about this condition. HCMA visited us in early 2020 before the COVID pandemic, and we had very great feedback from them, and we've implemented a lot of changes to enhance patient experience. We've also been very lucky with Lisa's help to have Dr. Harry Lever mentor us over the past couple of years. I think we've had more than 50 sessions with him almost on a weekly basis to discuss all our cases. And I consider now Harry as a friend as well as a mentor. We provide all comprehensive services to patients with hypertrophic cardiomyopathy. We have a dedicated HCM line or number which patients can call in, or even if they want, they can email us. We have a dedicated scheduler so that we make the patient experience quite efficient, and the patients can have timely testing and appointments. We centralize our testing and appointments at our main location. So the MRI is on the first floor, we are on the third floor, echo is on the third floor, so they don't have to go to many different places in our hospital. All our stress testing, because stress testing is extremely important, especially to bring out symptoms, to evaluate for arrhythmias with exercise, and the most important thing, to bring out occult obstruction with exercise. All our stress testing is physician supervised. All our MRI is physician supervised. We have a dedicated hypertrophic cardiomyopathy nurse practitioner, Ludmila Kuchma. She's excellent. We have a dedicated genetic counselor. We encourage genetic testing in our patients with hypertrophic cardiomyopathy and families. So Kimberly Provenzano is our genetic counselor, and she does a fantastic job. We provide heart rhythm services with Dr. Chuprun. We have Dr. Chiran, who is a very experienced surgeon who does our myectomies. Our outcomes with myectomies have been excellent. And we have Dr. Jeremiah Depta, who provides alcohol septal ablation in selected patients. We partner with the Westchester Medical Center, Dr. Naidu, who's been also a great mentor to us for our advanced heart failure patients who may need cardiac transplantation evaluation. We also partner with Buffalo Children's Hospital for providing pediatric care to our patients. We do have IRB registry to monitor outcomes of all our patients with regards to mortality, with regards to outcomes with alcohol septal ablation, with regards to myectomies. I also would like to thank Dr. Martinez, I know, who's going to be speaking later today. We've had a couple of sessions with him, and he's been a great mentor. I know Dr. Masera from NYU, he's been very helpful, and also Dr. Wever-Pinzon, who's from Utah. We've talked on a couple of occasions. Finally, I would like to say that we try to provide very comprehensive, individualized care to patients with hypertrophic cardiomyopathy. As Lisa mentioned earlier, if you're having symptoms of shortness of breath, chest discomfort, lightheadedness, fatigue, you should bring it up to your primary care physician to see if you need to see a cardiologist. I have many patients who were labeled as having anxiety or asthma for a long period of time, but eventually found to have obstructive hypertrophic cardiomyopathy. If there's a murmur which is unexplained, that's another reason to seek a cardiology opinion. So again, thank you to Lisa. Thank you for the HCMA. And I'll also like to thank my patients.
Bipul, thank you so much. And I have to give a programming note here. We invited centers, if they wanted to come talk to us today, to take some time out of their day and join HCM Awareness Day with us. We did not choreograph or ask them to discuss any particular topic. We said, this is your 15 minutes. It's HCM Day. You're part of the community. Come share. But what just happened in the last 2-3 sessions, they each bring up something else that's really, I think, almost magical about the HCM community and HCM care. What you mentioned about, okay, we talked early on, the program was very tiny. You said, I want to do this. I said, I need care in that area for our community. We're going to make this, we're going to help you make this work. So I said, I want you to meet some people. And I introduced you to Harry Lever. And then we made sure that you knew Damasara. And then you knew Hari Lever Hari Naidu. And we helped build a support network for you and your team to learn clinically from those who know best. And not only did you establish better critical thinking about HCM management and technical skills on echo and imaging, but you've developed friendships and partnerships that will be lasting a lifetime for you professionally, while you're starting to develop this long-term relationship I spoke about with Sara, about this longitudinal family thing. So you're one of the very few directors who's actually been in my office, because you came down to Jersey to meet with Matt Martinez to talk about, I think it was MRI or whatever, you were looking at an MRI machine at that point. So I think you just highlighted like my dream team concept. You have access to all of these physicians. They have access to you to care for families in your community that have family members in their community. We are really building a worldwide network where patients won't ever fall through the cracks again. So I thank you for your partnership.
Thank you. And I have to say, like every HCM specialist that I've interacted with via email or phone, I had a patient with Fabry's disease, so I needed to talk to the doctor in Memphis. Everybody's been very, very, very approachable via email, text. Most of the people give out their cell phone numbers. So it's a very close-knit community. And I'm really thankful, Lisa, for your help building that.
It is my life's work, and I'm thrilled to be able to do it. So thank you so much for sharing some of HCM Awareness Day with us. We are now about to pivot to Middle America, and we're going to St. Louis next. So Bipul, thank you so much for being here today. And coming up next, I believe, is Dr. Richard Bach from Washington University, Barnes-Jewish. Richard, I'm going to ask to unmute you, and if somebody can help me bring him to the front stage. Good morning and welcome to HCM Awareness Day. Rich, how you doing?
Morning. How are you? Can you hear me, Lisa?
We can hear you.
And can I share my screen for some slides, do we think?
You absolutely can.
Let's give it a try. Can you see my slides?
Yes, but you're not in present mode yet, so you're almost there.
Here we go.
One more click, maybe two.
Okay. Is that up on the screen?
Perfect.
Awesome.
The stage is yours.
All right. I know I only have a few minutes. I want to say first that I'm very grateful for Lisa inviting me to say a few words about our center here at Barnes-Jewish Hospital. We are in the middle of the country, St. Louis, Missouri. It's a little cold here today, but sunny, so that's nice at least. But I've known Lisa for, I think it's more than 20 years, Lisa. We met at a National Heart meeting. And I have to say, there is no one who has done more for HCM patients over the years that I've seen. You have been a remarkable guardian angel and maybe pit bull, if you don't mind the analogy, for anyone with this diagnosis nationwide and now globally. And it's been impressive to see what's evolved over the past 20 years. As you know, I got involved in this field also more than 20 years ago and felt it important to create a center here at our institution because I saw there needed to be better awareness, there needed to be better treatment, there needed to be comprehensive care, and the fragmentation and lack of awareness that existed, and it still persists. It's an ongoing battle. And today is just an example of the kind of work you've done to improve awareness and improve the care of individuals with HCM. So I applaud you for that. I applaud this day, and I'm very grateful for the opportunity to participate in this Awareness Day. Here's a nice picture of our institution. It also keeps evolving. They're knocking down and building new buildings all the time. So we're making even improvements in the infrastructure here. But what I really want to talk about today is some of the wonderful people that I'm fortunate to work with in our center. I think in the previous couple of centers you've heard about, they're describing those services that are available for patients. And likewise, I want to take a few moments here to talk about the wonderful people at our Center of Excellence here at Barnes-Jewish Hospital, Washington University, because they really are the family. You brought up that term, Lisa. I believe in it strongly. Not only are the patients who come here joining our family, but the physicians that I work with are the core of my family here for providing expertise and comprehensive management for anyone who has hypertrophic cardiomyopathy, whatever their issues are in their family. And so we are making a commitment to anyone who comes here. You see at the center of this diagram, it says Center of Excellence. What's really at the center of this community is the patient who comes to our center, because that patient will have available any of these different wonderful individuals who can provide expertise, not just expertise in cardiology, but special expertise in hypertrophic cardiomyopathy that's been growing and developing for more than 20 years here. So you see my picture over here on the left. I've been directing the center, as I said, for many years here. And I started my career as an interventional cardiologist, and I have a nice relationship with Lisa regardless, I hope. But what I learned early on is the septal reduction procedures are really only one aspect of the care of an individual with hypertrophic cardiomyopathy. And we really want to focus on shared decision-making. Everyone on this diagram is a strong believer in our core philosophy of shared decision-making for even the earliest decisions, family screening, genetic testing, medical treatments, but then very importantly, decisions regarding invasive treatments like septal reduction therapies. They're all part of a more general format of shared decision-making. So I spend a lot of time in the office now. I see many of the patients myself, but some of my colleagues also see patients in the office, but we share this philosophical approach of shared decision-making. And as Sara said so nicely, education that is part of learning about what hypertrophic cardiomyopathy means, what it implies for the patient and for their family, and how that fits into a bigger picture of the context of management issues and care. So we don't want to neglect the very important aspects of the fundamentals of medical treatments, of symptom management, of quality of life. All of that is part of our assessment for an individual who comes to our center. Many individuals do come to our center from the entire region. So we would like and serve as a resource for the community, not just locally here in St. Louis, but for the entire region in the Midwest. And one of the amazing things about Lisa is that sometimes she's calling me on her cell phone, and she catches me any time of the day or evening to let me know that she just had a conversation with a patient who might be in trouble or having trouble finding appropriate care. And we will respond to that by, getting that patient in to see them as quickly and as importantly as we can to help start catalyzing appropriate and comprehensive care. But let me introduce you to some of the other individuals who are on this slide. Anita Bondawad has been working with me in the center and seeing individuals in the office. Also for many years at our center. She's a very caring and wonderful physician in our center. And she goes to the mat for her patients with respect to establishing the diagnosis, caring for them and their family members. And Anita's been one of the foundational people in our center. Sharon Cressy is our imaging specialist, if I might call it, for echo imaging. She has special expertise in echocardiography and is a very experienced echocardiographer here, probably about 30 years at this institution working in echocardiography and genetics. So she wears two hats in our center. She provides special expertise in echocardiography. If you're aware, she just put together, along with some of our other colleagues, a publication about the evaluation of mitral regurgitation in individuals with hypertrophic cardiomyopathy and assessing whether or not there's intrinsic mitral valve problems that might need independent management versus mitral regurgitation being secondary, as it typically is, to outflow tract obstruction in individuals who have hypertrophic cardiomyopathy. And that was just published a few months ago. So Sharon represents part of the research side of our institution as well. And she provides the high-level genetic counseling for individuals who are either interested in or have indications for genetic testing and family screening. So she'll see individuals in the office or by televisits to help them determine whether they want to and then move ahead with genetic testing. And so she does a lot here with respect to both imaging and management of individuals and their family members for the sake of the Center of Excellence. Many of you who have come to our center will know Mary Gliva. Mary Gliva is a leading electrophysiologist at our institution and nationwide. Mary has special expertise in hypertrophic cardiomyopathy. She's been a member of our Center of Excellence for many years. And she has the kind of expertise that can help with many of the typical electrophysiologic accompaniments of hypertrophic cardiomyopathy, whether it's determining whether a preventative ICD is indicated or a patient needs management for arrhythmias like atrial fibrillation or ventricular arrhythmias. Mary has a very caring demeanor and is someone who spends a lot of time. One of the themes of our center is that our physicians do spend a lot of time with their patients in the office, and Mary does that to a fault. So she helps with educating individuals, with determining their needs, and with providing what is expert management for these very complex arrhythmia situations that are very common amongst individuals with hypertrophic cardiomyopathy. We're fortunate to have added in the last few years Justin Hardepy, who is another member of our group and who has special expertise and training in heart failure and cardiac transplantation. He's a member of our cardiac transplantation team. And so Justin, with both special expertise in hypertrophic cardiomyopathy and in heart failure management, provides a very important component for individuals who have advanced stages of heart failure and who may need consideration of cardiac transplantation. I've always felt that it was an important component of a comprehensive center to have an individual on that group on our Center of Excellence team who has special expertise in cardiac transplantation. So individuals who need to at least have consideration of that as a treatment option have a person in their corner who can help them go through all the steps it takes to get appropriate evaluation. And some individuals who develop refractory and severe advanced heart failure may need consideration of advanced cardiac support options, of which Justin is very well-versed and a special expert in any of those considerations. We've also added another, a relatively newer member, Mustafa Husseini, who provides some additional training and expertise in sports cardiology. So another aspect of our center is that for young individuals or any individuals who have questions regarding sports issues or how to manage the potential for evaluation for sports when heart disease, including hypertrophic cardiomyopathy, is on the table, Mustafa is a welcome addition in that regard. And then finally, when it comes to septal myectomy, we have a couple of very experienced surgeons. Dr. Ralph Damiano has been our head of cardiac surgery here for many years. He has additional wonderful, and we're fortunate to have special expertise in May's surgery and in a mini sternotomy approach. And so individuals here who come for septal myectomy have a very experienced surgeon. We have a very large experience now, a large volume of over the last several years who are managed by Dr. Damiano with respect to myectomy being done either by a mini sternotomy or traditional sternotomy. And then for those individuals with coincident arrhythmia problems like atrial fibrillation, he provides really advanced level technical skills in May's surgery as well, with some very nice outcomes that I can vouch for over the last several years in a situation that may provide some challenges for management. That is atrial fibrillation in patients who are symptomatic from it and having difficulty with medical management, or as we know, some challenges with catheter-based ablation. And more recently joining our group from the Mayo Clinic is Kunal Katkar. And Kunal, another fantastic surgeon. He also has special expertise in advanced cardiac support surgery. But Kunal has also provided some of the newer techniques with apical myectomy surgery. He and Dr. Damiano work together on many of the cases. We have, as many of the centers likely have, a multidisciplinary meeting on a monthly basis where we discuss some of these more complex cases and decide as a team approach with the expertise of the entire group as to whether patients may be candidates for more advanced treatment options. We're very fortunate at our center to have surgeons who have skills in those advanced treatment options. So this is the group that one might meet if they come to our center for care when it comes to hypertrophic cardiomyopathy. And I would say, care is our watchword. I'm a person who believes very strongly, and I learned this the hard way in the early days of our center, that individuals really do need comprehensive care. The secret of caring for patients is caring for the patients. And that rings true, especially with hypertrophic cardiomyopathy, where the problems don't just involve one individual who has the diagnosis, but their entire family and implications for the future. So we take this philosophical approach for the care of the individuals, and I would emphasize all of these individuals are very caring, very wonderful physicians who I would love to send any of my family members to if they had any sort of cardiac problems. But fortunately, they have special expertise in hypertrophic cardiomyopathy. Just so that individuals who are interested are aware, this is the number for our center. It goes directly to my office, and my assistant, who's named Millie Kova. Any of you who've come here know Millie. She moves mountains to get patients in, to have them get triaged to the right place, to have them get their imaging studies. We have, like the other centers, you'll hear advanced technical expertise in imaging for hypertrophic cardiomyopathy, both with respect to echocardiography. We have sonographers that were hand selected and have been doing all the studies for hypertrophic cardiomyopathy over the last several years. So they really have done thousands and thousands of studies. And when an individual comes with sometimes complex anatomy, they can provide imaging that's hard to match anywhere you'll find in the country. So Millie will help coordinate any of that for any individuals who would like to come to our center. I shouldn't leave out, we also are proud of the fact that we are a research institution here. And so when it comes to newer treatments, and that includes the newer medical treatments that are on the horizon and very exciting. And again, Lisa has found the right time to have an awareness day, because Very soon, we're anticipating there may be some new treatment options. We have we've been doing those studies like some of the other centers since the beginning when it comes to the myosin inhibitors like mavacamten, but not just mavacamten, but other agents that are in testing. We are participating in clinical trials that if individuals were interested, we have a nurse coordinator who, like everyone else, very caring, very involved in education of patients, would be happy to discuss the involvement in any clinical studies for anyone who would like to volunteer to those studies. And that's sort of, once again, the approach that we have. We want to support individuals so they have access to these studies of new medications that are very promising, very exciting, but it is entirely on a voluntary basis. So anyone who's interested, please feel free to contact me at the number you see on the screen. And Lisa, that's all I have about the center here at Washington University. I want to thank you again for giving me the opportunity today to participate in this great session. Thanks.
It's great to have you. A couple follow-up points, because you got me on a jab there on the interventional cardiology thing. Don't think I missed that. I did not miss that. So I think we need to let people understand that you and I met, and I don't even know how this is possible because I'm 28, right? We met in the late 90s. And yes, at that time, this concept came from Germany, this alcohol septal ablation. It was going to be the panacea. And shout out to Bill Spencer, who adopted this with unbridled enthusiasm and shared the message far and wide that this is a great treatment for HCM. Well, he was right and wrong. And a lot of people kind of drank a little Kool-Aid on that one, like this was it. It was the thing. Well, it's the thing for some people, not for everybody. And I was just coming off the tails of dual chamber pacing was the thing. It was going to be the fix for everybody. So I was starting my life in advocacy with a raw mark on dual chamber pacing. And now there was this thing called alcohol septal ablation. I'm like, okay, everybody needs to cool their jets because we saw what happened just a few minutes ago. And that's kind of when I met you. And I can remember going up to posters and standing there next to you, kind of debating, like, why would you do this? Why wouldn't you do that? What about this? What about that? And this look on your face is like, who the hell is this girl?
Well, Lisa, I want to say, I come from New York, so I very much respected your skepticism. I think it's healthy skepticism. When it comes to any new treatment, all of us need to be skeptical enough that we have care and attention to the details. And it turns out, I'm a strong believer, as you know, that alcohol ablation is an important treatment option for many individuals.
I agree.
Because they're not better candidates or good candidates for surgery, or, they would prefer it. And so I would put that plug in that it fits a very important role in the treatment of patients with obstructive hypertrophic cardiomyopathy. And I would still advocate for that. But I respect, and in fact, I think it was healthy for the field to have that skepticism early on. And I'm glad we didn't all drink the Kool-Aid and end up like the people in Jonestown. Thanks very much for that analogy. But I think
we all got excited together. We all got calm together, and we found equilibrium together.
Good. Yes. I agree with you.
And I think that's the long story of HCM, is that we roll and we evolve and things change, and we have to be smart enough to know what we don't know and brave enough to come up with ideas and try them and find where everything fits. We used to have a very scant toolbox. We got some tools now, and it's awesome to have tools for patients. Rich, I thank you and your entire team for your continued support, and thank you for joining us on HCM Day. We are now coming back to the East Coast, and we're going to be with Matt Martinez at Atlantic Health. And Matt, come on in, and I have to share a picture that just came across my cell phone. It's going to be a weird picture, people. This is the Shannon T. Mass team at Morristown. There it is, all dressed in red, has the red masks on, all for HCM Awareness Day. Yay, team. Well done, Matt.
I just took off my red mask, Lisa.
Okay.
So yeah, I'm going to give you a highlighted video version of that. Thanks for joining us. You and I can't get away from each other. All we do is spend time together.
Just lost you there for a minute, Matt.
Come
on back. What would you say?
I'm still here.
Okay, I lost you there for a second on audio.
You and I can't get rid of each other. We spend tons of time together this month.
We have, and I mentioned this a little bit earlier. We did a media tour. So Matt was my guest or he was my guest or I was his. I don't know. We did it together.
I think I was your guest.
I don't know. I think I was yours. So he did the medical, I did the patient, and we did 25 interviews back to back to back to back to back to back to back. I didn't do 25 because that would just sound silly. And as of this morning, I understand we have over 25 million impressions. And we have to thank BMS for helping fund getting that out there, that whole media tour thing. So thanks, guys, for your support of raising awareness of HCM. 100%. And Matt and I talked an awful lot. And by the end of the day, we're like, HCM, what? Do we really? It's a little much.
It was a great day. It was a great day. And I think many of those are still being shown today, right? I still think there's some
of them are airing just today. So yay.
Well, thanks for having us. We are excited. I'm going to do a little bit of a slideshow. I trimmed it down watching other folks do theirs so that if the case there's any off the cuff things we need to talk about. But thanks for having us. We're having a crazy day here. Everybody's in red. We got masks that are red. We brought some food in for the staff because, as you know, and man, they work hard. They work overtime. They work often. They're calling people back. I'm calling them at crazy hours of the day saying, I'm sorry, I got to add another one.
So team, next year, HCMA Day, HCM Day, both. We'll send little gift boxes out and they'll all open them at the same time.
Love it.
My team loves when I do this. I'm like, put a pin in that. That's a good idea. So team, next year. Okay, well, Matt, it's all yours. Want to do a screen share?
Yeah, let me get a little share action there.
While you're talking, I'm going to be on mute with my camera for a minute because I have to go get something to drink.
Now, can you see the one that's full screen before you go?
I can. You are good to go. And I love that you used our artwork. So thank you.
Well, fantastic day. And thanks for having us involved. I'm Matt Martinez. I'm a clinical cardiologist. We're going to talk about what our program looks like. I'm the co-director of the hypertrophic cardiomyopathy program and the director of the sports cardiology program from Dr. Bach. You just heard about Mustafa Husseini, who was one of the FITs when I was the chair of our section. So we knew Mustafa well. They're in good hands out there in St. Louis with that team, and he's a great addition. We are located in the great state of New Jersey. We are right near Lisa, which is fantastic. That connection has been fabulous. It's densely packed, New Jersey, as you know. Anybody who's been driving through here, COVID opened up some roadways, but they're filling up again. We are easy access to New York City and Pennsylvania, and we see lots of folks from there. I actually have my license in New York, PA, of course, New Jersey, Florida, and several other states to allow some of that follow-up, which can be a challenge. If you travel hours and hours, it's nice to maybe get a phone call back where we can video through and I can show you some images. We're at Atlantic Health in Morristown Medical Center. The big center, the flagship is in Morristown, and that's where we're located, right across the street. You may know us for our cardiology expertise in other stuff, cardiac surgery and TAVRs, and we'll talk about those teams in a minute. But the HCM program has now really taken off. And in 2014 is when it got started from a grant from the Mast family. Bob and Terry have really been champions for this locally in our institution, starting the Shannon T. Mast hypertrophic cardiomyopathy program. And we're the only one. We're the only named program, I think, in the world, certainly in the United States. And we are the only program currently in the state of New Jersey. And we continue to grow on a regular basis. Now, this is our team, and that's why I'm the co-director, because the team is big. It includes those, Marty Marin and Ethan Rowan, who started the program in 2014 in a collaboration with Morristown Medical Center. And Dietra DeBose is our nurse practitioner, and she has been with us since the beginning. And it's been slowly growing to the point where I was asked to join them in 2019, which is when everything sort of changed for me. I left the Mayo Clinic about 12 years ago after training there and then doing some HCM program time with them. Started another program in a different state, and now many of those patients have come with me, and now we're building an exceptional center here in New Jersey, where we offer a weekly clinic, an inpatient and expansion of services. And Lisa has been guiding us along the way and pulling some of the strings to get Dr. Martinez to drive an hour and 20 minutes every day. Totally worth it. We are a center of excellence. We do everything. We manage athletes and we handle all of these things. Some are still evolving and growing, but our team is quite amazing. And this is the picture you just saw.
Oh, awesome.
We have a unique program, right? I'm in the back here and surrounded by all of these women in the front who keep me in line. And they do a phenomenal job. Many of the group here has been with us from the beginning, but as we've grown, this picture is going to get harder to take, Lisa, over time. It's doubled and tripled and 5-6 times where we started when it was just a couple of us in a small office with Marty and Ethan coming down just a couple of days a month. So it's not alone. We clearly do this as a group, right? Our imaging department is superb. Seth Uretsky runs that, continues to expand. Over 2,000 cardiac MRIs done on a regular basis here, on an annual basis here at Morristown. Our arrhythmia team is always available. They're collaborative. We talk a lot about how to manage folks. It's been amazing. And our interventional team, you probably know. Your cardiothoracic team, you probably know from other scenarios. And now Dr. Van Boxtel, who has specific focus and interest on myectomy, has joined us. And that experience continues to grow along with the collaboration with Marty and Ethan, so that we can still have this opportunity to share patients and make sure that patients get the right procedure for the right individual. We do research and we love it. We just enrolled our last patient because the study is closing for this Novartis study in a couple of weeks. And then Sequoia, I believe, is getting started soon and moving right along. We have a great collaboration with Tufts Medical Center and Atlantic Health, and we've done that since its inception in 2014. Thank you, donors. Really important. They have helped support this and allowed us to continue to grow this. And then both Marty and I were involved in the guidelines. Much of that data came from collaboration from the Tufts database and ours to help grow some of the experience with that. And then a recent publication about some disparities in hypertrophic cardiomyopathy. We're getting better at that. We get a new focus coming for that in the next year or so. Now, these next two topics are really my passion. Education is really what drives me. We were involved a little bit in the International Summit. We've done some clinical spotlight series to try and improve our ability to recognize HCM, both with the ASC, the American Heart Association, and the American College of Cardiology. Has been intimately involved with some grant support to try and drive an accelerated care. Now, Lisa was involved in this. She was involved with a heated panel with many of the folks that are talking today, but we're trying to get better at recognizing this so that we're not missing 80-85% or more of those with hypertrophic cardiomyopathy, either an underdiagnosis or an overdiagnosis. And then my last passion is really on safety. Whether you're an athlete, you're in the stands, you're an exerciser who is just doing your mild to moderate exercise for hypertrophic cardiomyopathy, hands-only CPR and AEDs are critical. And Bob Lorfink has been a huge champion for us to help support this. I just got back from Dallas. Last night at 1 o'clock in the morning, I flew down there and helped train the professional referees organization, PRO, so that they could be available on the field for soccer at all levels. But this is really an exciting piece for me. We're giving away defibrillators. You may see our next giveaway back here, the Zoll back there on my shelf. That's our next one to give away. Folks who need this, who can't afford it, who need some additional education and support. We are pumped to try and deliver this in the tri-state to try and improve safety, whether you have HCM or not. So that's it, Miss Lisa, and I see you're back from your drink break. I'm excited to just continue this conversation. Thanks for having us. The centers have been amazing. It's really quite a cool group to be associated with.
It's a very cool group to be associated with. And I'm sorry about the little minor chaos here. For some reason, if I mute my mic, I mute everybody today. Webinar weirdness. And they had a little coffee mishap here. So my extra coffee it was leaking. My cup was leaking, and I just turned around and there's like water heading towards the soundboard. So I got a little freaked out. So sorry about any noise in the background.
All good.
We are all human, and someday we'll be perfect, but today's not looking perfect for me. Okay, so Matt, you brought up some excellent points. I love the focus on CPR and AEDs. You know, it's the duh moment. I can remember back in the late 90s, I went to the school boards and I said, you need AEDs. And they looked at me and thought I was crazy. Rockaway Township had brought it on in Rockaway Township, New Jersey, brought it on in 1999. And it took me to 2002 to get the high school to come on board. But we've been on board for a long time here, and they've been used successfully in the Hills District, Morris Hills Regional District. They have, and I don't know about the grammar school, but we were talking about this 20 years ago, and we still have so much work to do.
Yeah,
still so much work to do.
So I try and focus on it still, as you know, it's the final common pathway. We can have a fist fight over EKG screening or management or who gets what, but the reality is this works. It works well. You got to have them close. You got to get a little bit of training. It's easy to do. I tell people you ought to be able to drive a stick, do hands-only CPR and an AED, and learn how to swim. Those are the three things you ought to finish high school with. I'm still working on it on my kids.
I don't know. I'm not sure. I don't know that all of mine can. I don't know about a stick on all of them, but I can do it. So.
Me too. The stick's getting harder.
It ain't pretty. It ain't pretty, but it can be done.
That's right. That's mine as well.
So your team is amazing. And there's a soft spot in my heart for Morristown because like it's my town, my community. And probably now, again, I'm going to feel old. What's it, about 18 years ago? I said, don't come to Morristown, Matt. We're not ready for you.
You did. That's correct.
And I said, it's not ready yet. We need some work here. And the work happened, and it all came full circle. And here we are with a fantastic program, very comprehensive, lots more to come. And you're right down the street from me. So I know where my family can go. So thank you. And thanks the whole team.
Thanks for doing all you do. As you know, I tell people we're the most watched program in the country. If Lisa needs me, she comes right down the street. So we are happy to collaborate with you. The more we do, the better people do. So we're excited.
So it is kind of funny. Like, I don't think I've ever actually walked in the door, but I've thought about it. I will want to give another little shout out here because we're not going to talk a lot about some of our new committees later on in the day, but Deirdre DeBose, your nurse practitioner extraordinaire, will be joining the HCMA's Health Equity Committee moving forward. So we're really excited to have her on board for that, and a number of other individuals will be joining. But we need to really start focusing on this problem of health inequity in HCM and start to balance the playing field a little bit. So we're really looking forward to working closely with Deetra on this. So thank you for sharing her talents with us. And it's no secret also that a member of your tribe is a member of our tribe. So you hire from within the big-hearted community, and we thank you for that. So
we love her. She's a great addition. It's there's nothing like street credibility when someone says, well, you don't understand. And she says, well, I kind of do.
I do. So thank you. Shout out there. And that's about it for us today. I think we've spent enough time sitting in Zoom rooms, so it's going to be a dinner soon. Agreed. So we can see human faces. And now we're going to go to some pre-recorded sessions from the other side of the country. We're going to hear from Utah now. So Matt, thanks for everything. Thanks for your partnership, and thanks for being part of HCM Awareness Day.
You got it. Thanks for having me. Bye-bye.
Of course. Well, I'm back to a single player here for a little while, and I am going to actually play you some pre-recorded videos because, as I mentioned earlier, not all of our programs were able to be with us in person. So I cannot mute my microphone. So I am going to go black for a moment. And if you hear any background noise, my apologies. I'm going to try not to make any. But we're going to hear now from Utah. And go.
to the University of Utah team of hypertrophic cardiomyopathy. We're here today to celebrate this amazing day to try to increase awareness and really help you and others learn more about hypertrophic cardiomyopathy. At the University of Utah, we have a great team of folks, and this is a disease that really lends itself to a great team. And I want to introduce our team to you and share some stuff about the University of Utah that we think might be valuable to you. So my name is Craig Salzman. I'm one of the cardiothoracic surgeons here, and I couldn't do any of this. I don't do anything. This team next to me does it all, and it's led by one of our cardiologists here, Omar. And so, Omar, why don't you tell a little bit about yourself and when you came and the program that you started.
I'm Dr. Omar Wever-Pinzon. I'm the medical director of the hypertrophic cardiomyopathy program here at the University of Utah. I joined this team in 2015. We built this program as a multidisciplinary team with the main goal of fulfill the needs, diagnostic and treatment needs of our HCM communities, not only in the state of Utah, but also in the surrounding states. This program has grown over the years tremendously. From 2015, we had about 25 active patients, and we have grown to a volume of about 400 active patients nowadays. We take care of this population in different disciplines. In 2019, we became a center of excellence, and we are very appreciative of the support of the HCMA, or the Hypertrophic Cardiomyopathy Association. None of this success and this great experience that we have had over the years would have been possible with my right hand, with our HCM physician assistant, which I'm gonna talk to you.
Hi, I'm Holly Andrews. I'm physician assistant working with our hypertrophic cardiomyopathy clinic. Dr. Wever-Pinzon asked me to join the clinic in 2018, and it's been an incredible experience since then. Our patients, again, come from all over: Montana, Colorado, Arizona, Nevada, Wyoming, and Idaho. So we see a large number of people from the surrounding areas. We do telemedicine, in-person visits. In clinic, the purpose of having both our physician and a physician assistant is being able to maximize the amount of people that we can see and dates that we see. Typically, our hypertrophic cardiomyopathy clinic is reserved for Thursdays, but that doesn't work for patients all the time. So I'm in clinic 5 days a week, 90% of the time, and we're able to fit patients in for any of those other days. One of the reasons why I actually went into medicine is for the teaching opportunities. And that's one of the incredible things that we do in our clinic, is we are able to spend a lot of time teaching about this disease, because it doesn't just affect our patient, just the patient. It affects their family members and their children, their parents, their siblings. And so when we find somebody with hypertrophic cardiomyopathy, we have to involve care for the entire family. And that takes a lot of time to talk about the ins and outs and what we need to do for this. So I love that our clinic offers that ability to see them any day of the week and to be able to spend that time with our education as well. To do that, we have to coordinate quite a few things. So there's a lot of testing that has to go on for these patients. And so we have our program director, Nicole Segura, who's going to talk a little bit about that.
Hi, I'm Nicole. The best part of my job is that I'm able to meet our patients from the time that we get their first referral to getting them into clinic. We make sure that we get all their records set up so that we're able to maximize their time efficiently and coordinate all of their appointments for same day, because a lot of our patients are coming from out of state. We're able to help with housing if they need while they're here. And I love just being able to get to know our patients and make sure that they're taken care of.
Building this program has created a huge impact here at the cardiovascular medicine division of our university. With our program, we actually hired our first genetic counselor, which, and from there we have created our genetic program, and which has had a tremendous impact in our clinical care, also in the research field. When we talk about medical therapies in HCM, we know that the medical management of HCM hasn't changed significantly over the years, but in the last decade, we have seen a number of therapies that have come out and are being tested in clinical trials. For instance, the group of myosin inhibitors and other agents that affect metabolism and other targets that in genetics as well. And we are part of those trials, and we're happy to be part of those trials because we know that that creates an impact in the community, the HCM community. Some of the trials that we have participated involve testing the safety of exercise in patients with hypertrophic cardiomyopathy and other genetic conditions, such as long QT syndrome. We have also been involved in phase 2 and phase 3 trials, testing medical options, specifically trials of myosin inhibitors, mavacamten, in the use of patients with obstructive hypertrophic cardiomyopathy, and also in the population of the non-obstructive cardiomyopathy patients.
We also have 2 upcoming clinical trials. We actually have one for obstructive patients that's going to be starting in March, and then we think we have one for non-obstructive patients starting hopefully April. That timeline may change just a little, but the exciting part is they're upcoming soon this year, which we're very excited about for our patients.
The interesting thing is how much you guys hate surgery, you know, and part of it is because the medicines have become so good. But there are a group of patients that really do benefit from more interventional approaches, including things like septal ablation, alcohol septal ablation, as well as more traditional surgeries. I did my first myectomy a little over 20 years ago, and a lot has changed in the way that we approach surgical disease. We're starting to see a lot of patients coming back with recurrence of disease, and also really starting to recognize that the mitral valve is a really important part of this process of patients that have the HCM, the obstructive cardiomyopathy, and trying to deal with these has enabled us to utilize alternative approaches, including transcatheter approaches to deal with outflow obstruction associated with the mitral valve. And so it's a real comprehensive approach. And some of these patients, unfortunately, because of the hypertrophic cardiomyopathy, generalized hypertrophic cardiomyopathy, actually need to have transplantation. So we are pretty fortunate here at the University of Utah to be part of a more global group, not just within hypertrophic cardiomyopathy, but a number of other cardiomyopathies and advanced heart failure, such that whether or not we might need to use mechanical support or move to transplantation is a relatively smooth process for all of us here.
When our patients are referred to us for hypertrophic cardiomyopathy to start with, most of our patients, they tell us there's a lot of anxiety going forward with it because they Googled everything they can on the internet and they're not quite sure what to expect. So again, a lot of what we do in clinic is starting to educate about what this disease is, what it means for them in their lifespan, what it means for their family members. And then once we have that baseline knowledge, we're able to then ask them to go to their family and ask them to talk about their medical history so that way they can create awareness in their own homes and their own family. Now, the broader part, I think, is where we are starting to work on things more. This hypertrophic cardiomyopathy awareness day, the first one ever, that's going to be on Wednesday, February 23rd, I think is an incredible thing to be able to get more of this out into the community. Here, we talk a lot about hypertrophic cardiomyopathy and treatments and surgical procedures among other healthcare professionals. We get talked about in the community in different areas. And we personally are going to try and work on how we can get it out into the non-medical community. So to every person. And what we're doing with this is trying to do this video. We're going to be working more with our social media pages so that we can start spreading this word more. So it's not just coming from our patients. It's not just coming from physicians. It's going to be coming from the community as a whole as they recognize what this disease process is.
Our efforts have been focused on promoting HCM within our institution and also other institutions with different providers. But here's where the Hypertrophic Cardiomyopathy Association plays a key role, because we also restore our community to them through activities and symposiums that are organized by the HCM. Well, we hope you learned something out of this last few minutes with us here. And just remember, next time you come to Utah and you're going for a ski and you pass out, we're here at the University of Utah.
Proving that HCM humor, it's a thing. That was a beautiful video from our friends out in Utah. And now we are off to our next stop, which is Duke. And we're going to hear from Dr. Andrew Wang.
Hi, my name is Andrew Wang, and I'm a professor of medicine here at Duke University Hospital in Durham, North Carolina. And I also direct our hypertrophic cardiomyopathy clinic and program. I want to take this opportunity to thank the Hypertrophic Cardiomyopathy Association and Lisa Salberg and Stacy for organizing this HCM day. It's really our pleasure to be a part of it and to update you all about some of the things we've been doing here, some of the new people in our program that you're going to meet in just a minute. I'd also want to take a chance to recognize the patients and their families with hypertrophic cardiomyopathy. I know that the disease itself is a challenge in terms of getting good advice and information and expert care, which is why the HCMA is so important in their advocacy and helping patients navigate many of these roadblocks. So I want to take a chance to recognize our patients, and especially what they've been through in the last few years of the pandemic. I've seen a lot of the stress that our patients have been through, and I just want to take a moment to recognize the difficulties and say that we're all trying to help. So I'm pleased to have this opportunity to talk about some of the updates in our program. And I'll just mention the background a little bit and sort of where we are now. So I started seeing patients with hypertrophic cardiomyopathy about almost 20 years ago, and it's really grown as the information and the therapies for this condition has grown as well. We have a full day clinic every Monday in a new clinic building that just opened a few months ago. So that's one of the other updates that we have, and really have a comprehensive care of patients with hypertrophic cardiomyopathy, and have been recognized as a center of excellence by the HCMA for the last several years, thanks to Lisa. The two things that I'm most passionate about, I would say, are patient education. I think that it's hard to understand the complexity of hypertrophic cardiomyopathy and the treatment options that we have for the patients. And before the pandemic, we would hold almost an annual or every other year patient education day here in Durham, North Carolina, and really had a amazing turnout of number of patients and their family members. I think the last time we had it in downtown Durham, it was over 200 patients and their family members. But that was obviously before the pandemic. We look forward to getting back to that when it's safe to travel and gather together. The other thing I've been passionate about is evaluating novel therapies for hypertrophic cardiomyopathy. And we've been part of the clinical trials of many new drugs and therapies for hypertrophic cardiomyopathy, and most recently for the myosin inhibitors. We were part of the pivotal trial of mavacamten and are involved in the clinical trials of aficamten as well. And I think I've seen the benefit from many of our patients who are very much engaged and want to be part of these clinical trials to see the progress in the field and new treatment options for patients with hypertrophic cardiomyopathy. So that's my update, what I'm interested in. I hope to see many of you in person. I'm going to now introduce you to two people, and the first will be Dr. Carmelo Milano, who is a professor of surgery here at Duke Hospital, a close colleague of mine. He's also the section chief for adult cardiac surgery. He is our expert in myectomy and addressing the complex nature of outflow tract obstruction surgically in patients with hypertrophic cardiomyopathy. So I'll let Carmelo tell you what his focus and interests are.
Thank you, Andrew. And it's a pleasure to be involved in our Center of Excellence for Treatment of Hypertrophic Cardiomyopathy. Over the last several years, I have performed the majority of myectomies at our center, although we have two other surgeons, Don Glauer and Jeff Gesa, who are also very experienced. I am passionate about treating patients with hypertrophic cardiomyopathy, and I think one of the neat things is that each patient is very unique and has very unique features, and I think each case has to be dealt with in a unique manner. Some areas of surgical interest of mine. First, management of mitral valve insufficiency in patients who have hypertrophic obstructive cardiomyopathy is a dynamic topic, and there are a variety of different strategies. And I think that is still a challenge, and I think we're still learning how best to deal with the mitral insufficiency. Oftentimes, we don't have to deal with it. Oftentimes, just addressing the obstruction with myectomy resolves that problem. Another area of interest of mine are those patients in whom the obstruction may be deeper in the ventricle and not in a location underneath the aortic valve. Some patients have obstruction in the middle of the ventricular chamber, and sometimes there is obstruction at the very apex. And some of those patients can be best served with a different approach, which is through the left ventricular apex. The myectomy, the ventricular reduction can be performed through an incision in the LV apex rather than through the aortic valve. Finally, I'm also very involved in the heart transplant program, served as the program director for many years. Duke is one of the busiest heart transplant programs in the world. And each year we treat a number of patients with hypertrophic cardiomyopathy. And in general, these are patients who really don't have a lot of other health conditions. Their primary condition really is their cardiomyopathy, and they do very well with heart transplantation. So each year we get to treat a number of patients with cardiac transplantation. So again, it's a pleasure caring for patients with hypertrophic cardiomyopathy, and I find it one of the most interesting parts of my practice.
Thank you very much, Carmelo. And again, thanks for all your help with our patients. I'm now going to introduce you to Ms. Caitlin Amos. She's a certified genetic counselor, and we've been very fortunate to have her join our program in the last year. So she is really a big part of our outpatient hypertrophic cardiomyopathy program, and we've kept her very busy seeing patients both in person and virtually. So thanks, Caitlin.
Yeah, like Dr. Wang said, my name is Caitlin Amos, and I am a new genetic counselor working here at the Adult Cardiovascular Genetics Clinic at Duke. I'm really grateful to get to work alongside Dr. Wang in our HCM clinic as we care for patients and their families with hypertrophic cardiomyopathy. In my job, I think I'm most passionate about, like I said, working with Dr. Wang to help patients adjust to their diagnosis. Sometimes there's a big psychological and emotional component to that adjustment, and then also help them care for their at-risk relatives. My hope is that I'd help patients and their loved ones understand who else is at risk for developing this condition, so they can feel empowered and confident to take the necessary steps to care for themselves and their families. I know Dr. Wang said this, but I'm super grateful for the HCMA and the resource it's been for the patients I've worked with so far, as it's helped them learn about how to live with HCM and feel not alone in that process. I think it provides invaluable support and connection for individuals. And we talked about this before, but feel like it's the sort of poster child for patient resources and different indications. So thanks, Dr. Wang, and thanks, Dr. Milano.
Yeah, thank you both. So I want to again wrap this up by thanking everyone at the HCMA, thanking the patients and even many of the sponsors in industry who are really trying to move the field and the treatment of patients with hypertrophic cardiomyopathy forward. So thank you all from Duke, and hope to see you all in person soon.
Okay, I have next up, we are pivoting not too far geographically. We're going from, oops, I have Julie up top here. I don't know what happened there. There we go. I'm pivoting from North Carolina State over to Virginia. And I have Chris Kramer here with me now from the University of Virginia. So Chris, hey, how you doing?
Hey, Lisa. Yeah, thanks for having us here today. We're very excited
to HCMA Day.
It's a terrific day. Thank you and the HCMA for putting this together.
Well, we appreciate you being with us today. So you didn't send me slides, so I didn't know if you had anything you wanted to show or do.
Yeah, I have, if I can share my screen.
All on you. Go ahead.
All right. I'm Christopher Kramer. I'm director of the HCM Center of Excellence at University of Virginia. We've been a Center of Excellence since 2014. I've known Lisa longer than that. And I've been involved in the research and care of HCM patients for more than 3 decades, starting when I was a cardiovascular fellow long ago. So I want to tell you a little bit about our center at the University of Virginia. So, HCM is a genetic disease. So we involve our geneticist, Matt Thomas, who I'll present to you in a moment. And I want to start by really saying that the care of the HCM patient at UVA is team-based, as many of the other centers have expressed as well, and can't take care of patients with HCM without having a big team that are heavily involved in every aspect and every step of the care. So ranging from genetics to heart failure, to the treatment of arrhythmias, and to lifestyle interventions. So we offer the full gamut of HCM care here at UVA. Imaging is at the backbone of, first of all, making the diagnosis and then assessing the prognosis. And imaging involves both echocardiography and cardiac magnetic resonance in HCM. Todd Valines, I don't have pictured on the slide, runs our echo lab. I run our CMR program, and I'll speak to you in a moment about a big study that I co-direct that involves CMR and a comprehensive evaluation of HCM that's separate from our UVA center, but I want to mention it anyway. So I run the program, but I'm also heavily involved with imaging of patients with HCM. From a genetics standpoint, we assess personal risk and we do family screening. And we do that with the help of our geneticist extraordinaire, genetics counselor, Matt Thomas, who meets with each and every patient and their families and discusses family screening and genetic testing as needed and indicated. And so that he is part of every new patient visit to us at the University of Virginia. In terms of heart failure, treating both outflow obstruction and non-obstructive HCM. Let's talk first about obstructive HCM. Again, we have a strong team both on the medical side and the surgical side in terms of treating obstruction. John Kern, pictured here, is co-director along with me of the Heart and Vascular Center at UVA. He's the surgical co-director and I'm the medical co-director. And he is the one who does our myectomies at UVA when indicated. And John has been at UVA, I've been at UVA 23 years, and John was here when I came. He's been here for close to 30. Also, another person who's been here forever and been taking care of HCM patients for all of that time is Mike Ragasta, who's Director of Interventional Cardiology at UVA. And Dr. Ragasta is the interventional cardiologist who would do your alcohol septal ablation, should that be indicated in certain patients with HCM. So again, it's a team approach. We meet and discuss each and every patient and decide what the best therapy is for that particular patient. In terms of obstruction, as other centers have mentioned as well, we're very much involved in all of the trials of novel therapies in HCM in terms of treating obstruction, medical therapies, been involved in phase 2, phase 3, and phase 4 studies of these agents. So if you come to our center, it's something that being enrolled in a study is certainly possible if that's something of interest to you. Obviously, non-obstructive HCM is an important part and parcel of the disease. Jim Bergen is head of our heart failure group, and he's involved in the care of patients with HCM of heart failure who may not require treatment of obstruction with interventional therapy. So Jim is very involved with us as well. On the arrhythmia side, we have patients with HCM often have AFib as a common problem, but of even greater concern are ventricular arrhythmias. And for that, we may consider in the right patient putting in an implantable cardioverter defibrillator if indicated. Pam Mason is the director of our electrophysiology service and is intimately involved in the care of HCM patients at UVA, adult patients with HCM who require treatment of ventricular or atrial arrhythmias. George McDaniel, pictured below Pam, is a pediatric cardiologist and electrophysiologist who treats our pediatric patients with HCM who need treatment of their atrial or ventricular arrhythmias. Speaking of pediatric cardiologists, pictured here is Tom LaCure, who's our chair of pediatric cardiology, who does the primary care of patients under the age of 18 who present with HCM or have a family history. And so he would be the one seeing you or your children if you're under 18. And then lastly, but definitely not least, Michael Ayers, who joined our team a couple of years ago. He and I see the vast majority of the new initial visits of patients with HCM. And Michael joined us after training with the HCM group at the University of Pennsylvania. He's also an expert in sports cardiology and preventive cardiology. So he brings that expertise on top of his expertise in treating HCM and looking specifically at lifestyle, exercise, and comorbidities and their role in treating the underlying disease. So the sum of this slide is it points to the large team that we have at the University of Virginia to offer comprehensive care of you and your hypertrophic cardiomyopathy. We see patients from all over the state of Virginia into West Virginia, Maryland, and Pennsylvania, and we welcome you. And we like to think of ourselves as a championship team, like our NCAA championship basketball team from a couple of years ago. Here's the phone number that you can call to make an appointment. Generally, our wait times are under a month, and we do have telemedicine available, though that requires being in the state of Virginia at the time of the telemedicine visit. I do want to spend a couple of minutes talking about the HCMR study. So I'm a co-principal investigator of this study, along with Stefan Neubauer, who's at Oxford in the UK. And it's a large NHLBI, National Heart, Lung, and Blood Institute, that's part of NIH, funded registry involving all of these co-investigators, many of whom you may know from other HCM centers of excellence around the country and the world. And this is a large study involving, as I'll point out on the next slide, 44 sites from around the world, 22 in Europe and 22 in North America. And between 2014 and 2017, we recruited 2,750 patients with hypertrophic cardiomyopathy. Some of you who may be on this webinar who participate in this study, and it's ongoing. So at baseline, we did a comprehensive history. Generally, patients already had an echocardiogram, but at the time of enrollment, we did a cardiac MR study, as well as drew blood for genetics and biomarkers. We're at a mean of about 4.5 years of follow-up now. And the goal of the study is to do a better job of predicting outcome in HCM using really all this comprehensive data. It's the most comprehensive, the largest, most comprehensive study of HCM done to date, because it involves not only genetics, biomarkers, history, and echo, which have been included in other studies, but also involves the very important data that we can acquire from cardiac magnetic resonance imaging and the imaging of scar in the heart, which we think is an important part of risk and prognostication. So we need to wait another year or two to complete follow-up of this important study to really develop a risk model that will help us predict adverse outcomes in patients with HCM. So your physicians, at the end of the study, we hope they'll have a smartphone app, which they can input all your data, all the results of all this testing, and tell you what your 5-year risk of arrhythmias or heart failure and how that might impact your shared decision making with your physician about the next steps. So with that, I'll end and invite you to look at our center at the University of Virginia, and definitely watch out for the results of the HCMR study. And Lisa, thank you for including us today.
We are thrilled to have you with us, and so can't thank you enough for participating in HCM Awareness Day. And the work that you guys all collectively have done in HCMR has been really, game-changing. We're able to see a risk factor and quantify it better than we ever could before. And it just adds to our defenses so that we can employ or use our toolbox appropriately when necessary, not put devices in when they're not needed, but certainly not miss the opportunity to put them in when they are. So the work you're doing is truly changing the lives of hundreds of thousands of families worldwide. So Chris, on behalf of the community of patients, we thank you for that research. I know it's not easy to do those grants, to manage a $25 million budget from the NIH and try to actually make that money do everything you need it to do. That's a talent in and of itself. So I'm not sure how much patients really understand what goes on in the back end, trying to get articles published, try to get grants funded, try to get the time in to do the research while doing the clinical. You guys are juggling it beautifully, and we thank you. And I'm very happy to have been a part of encouraging patients to participate in HCMR and getting them to enroll. And that is part of the partnership that it makes the HCM community pretty damn cool. So
yeah,
thanks to everybody.
We thank the HCMA for really encouraging, having it on their website and encouraging patients at sites from all over the country and the world and to enroll in this important study.
Fantastic. Chris, thanks for being part of HCM Awareness Day. We can't thank you enough for being here. And we are going to pivot up the coast a little bit, up to Maryland. So we're staying East Coasty for a while, guys. And now we have Dr. Libin Wang, who's going to be joining us from the University of Maryland. And Libin, welcome to HCM Awareness Day. So happy to have you here.
Happy to see you, Lisa. Happy to see everyone virtually. Hi, thank you for the invitation.
Of course, we're happy to have you here. And hopefully someday soon we'll all get back in person and be able to see each other and enjoy HCM Awareness Day together, maybe in the future. So I'm going to hand it off to you. Do you have any slides to share with us, or do I have?
No, I think I'm just going to talk.
Okay, talk away.
Thank you. I'm not very technical good, so I didn't prepare any slide, but I would like to share the story of our center and me and with Lisa and HCMA. I'm Libin Wang. I'm the director of the Hypertrophic Cardiomyopathy Center of Excellence at the University of Maryland. Again, great to meet everyone on this historic day. And on behalf of our entire staff at the Hypertrophic Cardiomyopathy Center of Excellence at the University of Maryland. Happy HCM Day to all my patients in our center in the state of Maryland and around the United States. I am from China, and I really want to take this opportunity to deliver my greetings to all the HCM patients in my home country and around the world. And it's a double special day for some of my patients, as today is actually their birthday. So I want to take this opportunity to wish my patients a very happy birthday on this very first HCM Awareness Day. And recently I got the pleasure of taking care of a patient who actually found us via HCMA. One of the first questions that the patient asked me was, how long have you been working on HCM? This question actually quite surprised me, but then gave me an opportunity to reflect and look back the journey of our center and my own career in learning and treating HCM patients. So I came to the United States from China after finishing medical school in 1996. My dream, my US dream, was to become a master cardiologist and a scientist and to dedicate my career to cardiovascular medicine. But little did I know about hypertrophic cardiomyopathy. And it was the same year that happened to be that Miss Lisa Salberg founded the Hypertrophic Cardiomyopathy Association. At the time, I had no clue. I loved genetics, so I studied genetics and got my PhD in genetics from Texas A&M University in 2002. That's actually 20 years ago. And then I joined the Seidman Lab at the Harvard Medical School for postdoc training. It is in the Seidman Lab that I started working under the mentorship of Drs. Cricket and John Seidman, and worked and trained by my great friend, Carolyn Ho at Brigham. It is there that I really begin to learn a little bit of hypertrophic cardiomyopathy. And over the years, I learned more. I met many HCM patients with Cricket and with Carolyn at Brigham, and learned about their families and learned directly from their expert and the patient themselves, and how they manage hypertrophic cardiomyopathy every day. Like Lisa mentioned her journey, and everybody know her story. And studied genetics of hypertrophic cardiomyopathy in the lab, and I also used animal models to try to understand the molecular mechanism of hypertrophic cardiomyopathy. A lot of work in the Seidman Lab eventually laid the ground for mavacamten development. And what I really wanted to do in my early life was trying to help our patients by bringing my bench research experience to the bedside. And really, the basic research experience gave me a solid foundation to become a detail-oriented and skillful clinician. And I went on to finish my internal medicine residency at Jackson Memorial Hospital at the University of Miami in Florida. And afterwards, I came to Baltimore. For the past 10 years, I've been here, and I completed my cardiology fellowship at Johns Hopkins Hospital. I was fortunate to gain more clinical skills in diagnosing and treating HCM patients, especially under the guidance of Dr. Roselle and Ted Abraham, who are now at UCSF. So I joined the faculty at the University of Maryland School of Medicine in 2016. And it's really through the extensive research background and clinical training that I developed deep passion for the understanding of hypertrophic cardiomyopathy and try to learn more about our patient and how to help them every day. So I began to orchestrate and develop a multiple disciplines team at the University of Maryland to establish our own program. This is 21 years after I came to the US. My path had finally led to you, Lisa, and the HCMA, where I got to meet you and meet Lisa at the HCM Summit in Boston in 2017. And it was really her inspirational speech at the summit, and it deeply resonated with me and re-energized me to my commitment to the field of hypertrophic cardiomyopathy. And I really cannot thank Lisa enough for her guidance to establish our center and later on, our center got recognized by the HCMA for a center of excellence. And we, the entire team, myself, really appreciate the guidance and help with Lisa and HCMA. So we, over the past few years, we worked very closely with Lisa and the HCMA in coordinating care for our patient. In some cases, it was rather urgent. Patient need emergent procedures to be done. And really through the coordination, it's through the coordination with Lisa and HCMA and our center and my whole team and staff, and were we able to provide the patient's care immediately required in a very timely, sensitive manner. So over the past 6 years, my passion in hypertrophic cardiomyopathy had really ignited my whole team. That include my adult general cardiology colleagues, and including also pediatric cardiology colleagues. Those include Dr. Hong Zoman, Dr. Stacy Fisher, and pediatric cardiologist, Dr. Vashist. And we have advanced imaging team with radiology, Dr. Charlie White, Dr. Jin Judy, Dr. Ridwana Hussain. And our genetic team, Dr. Carol Green, she's a medicine geneticist, and our genetic counselor, Stephanie Riley, and our interventional cardiology colleague, Dr. Mark Wesley, electrophysiology doctor, Dr. Vincent C., who actually is my co-director. We actually got training together at the Brigham Women's, and cardiac surgery team with Dr. Brad Taylor. So our center over the past years have been participating in the clinical trials with mavacamten, and we anticipate in the upcoming years to be involved in the multiple clinical trials the previous centers and directors have mentioned. And really want to advance our scientific understanding of hypertrophic cardiomyopathy. And as our center grows, we are hoping to build our own HCM registry and collaborate with other centers to really improve the quality of care of patients and to foster innovative research. So at the University of Maryland for the past 6 years, I really wanted to make my personal mission to make every day an HCM day and to make the community aware of the condition and of the patient and their family, what they're going through. So I have personally reached out to about 2/3 of the cardiology practices in the state of Maryland in order really to broaden our awareness among our colleagues, both cardiology, surgery, and general internal medicine. There was a COVID, it came, and it's very hard to now mention COVID these days, but it did not stop our commitment. Rather, it actually emboldened our effort to reach out to our HCM patients in the state of Maryland and the surrounding region in any way possible, and either via in-person visit or via telemedicine. So when I told my new patient that I have been working on HCM and thinking hard about HCM almost every day for the past 20 years, it first made me feel old, but it did make him feel very comfortable. Oh, you're great, I'm in great hands. I'm not so sure. But it did remind me how little I knew about hypertrophic cardiomyopathy when I first came to the United States, how much I have learned from my mentors during postdoc research and through my clinical trainings, and how much I have learned over the years from collaboration with other centers and other friends at other hospitals. And really, most importantly, how much I've learned from my beloved patients, each individual of them and their families, and how much I continue to learn every day from my patients and my colleagues. So it really also makes me realize that there are still many unanswered questions. That's why we have so many research endeavors ongoing and are developing.
We have a little glitch. Libin, we've lost your audio. Oh, Libin, you're back. If we can unmute you and bring you back to stage, I think we're good.
Yeah, sorry.
And you're back.
All right, sorry about that.
That's okay.
Yeah, it really makes us make me realize there are still many unanswered question in the field of HCM, and we need to continue our effort to develop innovative research to help patients. So really this historic day make me also reflect on my own journey, and it reminds me of my father. And when I decided to study medicine as a young boy, and my father said one thing to me, that career of medicine is like sailing a boat against a stream. If you're now moving forward, you're moving backwards. So you have to learn something every single day and improve yourself. So I still remember the moment he told me this. It kept motivating me to learn every day from my patients and colleagues, and to improve and really become a better physician and a better person. I really look forward to continuing the learning journey in the decades to come, and really lead our center to its greatness. And we at the University of Maryland Hypertrophic Cardiomyopathy Center of Excellence will continue to work very closely with Ms. Lisa Salberg and the HCMA, and we look forward to many, many, many HCM days yet to come. Once again, happy HCMA Day to our community, our family, and thank you, Lisa.
Libin, thank you so much. There are so many wonderful people I've had the opportunity to meet in my life and in my journey and in my work. And one of the things that will forever tie you in my memory was reading your business plan for your application for recognition as an HCMA recognized center of excellence. And okay, I have to tell you, no offense to the other people who write them, they're dry because they're business plans, right? There's not supposed to be drama in a business plan. But here comes this application with starting off with kind of a dramatic statement, which was, and I may have this committed to memory, Libin. In 1996, when Lisa Salberg founded the Hypertrophic Cardiomyopathy Association, I left China to begin my education in cardiology in America. To tie those two moments together, and at the time, knowing all the time that had transpired since then and what we have done, and knowing that he was developing his whole career in that same timeline and that we've crossed, it was kind of a magic moment. It was pretty cool to think about it in that way. And you had been in the Seidman lab working with Cricket and John Seidman and Carolyn Ho and learning the genetics. And then again, the theme of partnership and collaboration through our centers is constant today. You go to Hopkins, you learn from Ted and Roselle, and then you move across town and you begin a program of your own at the University of Maryland. This is part of the magic of HCM. And there might be a competition one day, Libin. People may not expect this from you, but you have the most wicked sense of humor, and I love it. And you just don't expect it to come out. And then there's this amazingly funny, timely, appropriate comment or joke at the right moment. So I love you for that and for what you've built with your life and how much you've committed to patients. And we thank you very, very much for being part of HCM Awareness Day. And thanks to your entire team. Things ebb and change and flow and move and develop. And towns have, you were in a center at one side of town, and now you're on another side of town. I have to tell you that your old program came knocking on the door again. So we have a discussion going there. But there's so many HCM patients that need care. I don't think we should be afraid of that. This isn't competition, it's partnership, because we need in big cities, especially big cities with large populations of previously underserved communities. So Black and brown communities are not diagnosed enough with HCM, and Baltimore has the opportunity to see a lot more of that constituency and start to balance the equity of those diagnosed with HCM. So we have so much to do, and I love that you're one of our partners in it, and I appreciate everything you do every day. And we're gonna go, any other comments before we leave?
I love you, Lisa.
Oh, I love you too. And I love that you got the Snoopy thing at the gala because it fits so well with you. Okay, we are going to pivot up north now. Libin, thanks for being here. We're going to bring Dr. Hari Naidu up on the screen in just a moment. So we're going to go up to Westchester, New York, and I'm going to start we're going into afternoon session here. So boom, lights are on. So the background's going to slowly change throughout the day. Hari, welcome to HCM
Lisa,
Day.
how are you?
I'm still pumped and full of caffeine, and we're halfway through the day almost.
Yeah, it looks like a marathon day for you, Lisa.
It's like HCM Telethon and State of the Union all in one.
I know, but this is great. I mean, I don't know how many years we've done HCM Awareness Day, but this is kind of the big one, I think.
It's the first technical one?
I think so. There was a little bit last year, but I think this year, we're seeing a lot more efforts. So I think that's great. I'm putting some stuff on Twitter. You're doing this. I think the time has come because people, a few years ago, they'd be like, what's HCM? 10 years ago. Now, at least people know about it. And there's a whole day. So they know that there's something going on here.
Something's definitely going on here. So what's going on up in New York?
All right. I'm going to show some slides. That's cool.
Go right ahead.
All right. So let's come up here. All right. You can see this?
3, 2. Yes, I got it.
Okay, great. So, I'm going to give you some updates about the WMC program. You know all these things for our audience, and I'm going to highlight some people and certainly our team and obviously the HCMA as well. I'm going to go a little history because I think I heard Dr. Wang talking about how they've been involved for 20 years. I mean, I think the beauty is that people have been involved in this field now for a long time. And I think last time we talked, you called me, I think, second generation, first generation being the folks in the 70s and 80s. And then a couple of people like us came along. And then there's been a third generation, maybe even a fourth generation now. So it was interesting to put this together because you're right, we've been doing this for 20 years. So in 2002, I did my first alcohol ablation when I was a fellow at Penn. Then my first on my own was at Cornell in 2004. You were with me when we launched the program at Winthrop in 2006. I was on the guidelines at that time until 2011. That's what really sparked more my interest in being really part of this community and really being, helping the community grow. That came out in 2011. And together we launched the alcohol ablation course, as I'll show you, in 2014. We've done 5 of them since then. Then we published this textbook that you were a part of. You see that on the right. And the first edition came out in 2014 with about 30 authors. We moved the center to Westchester, where I am now for the past 6 years now, believe it or not. The second edition came out in 2018 and had something like 50 to 70 authors, 60 to 70 authors and 30 something chapters. I think you did 2 of those chapters, Lisa. So thank you. Myself and Dr. Panza came out with this cardiology clinics book. I'm not sure you saw that, but that was good. It's also smaller and much easier to digest. The textbook is 500 pages, a lot different. And then over the past few years, we've been involved here in the clinical trials, as you know. Helped present the Explorer late-breaking clinical trial for the symptom relief, or symptom aspects of that. We're part of Valor that will be presented next month in the New England Journal, hopefully, and the late-breaking clinical trial at ACC. There's a new board of HCM that's starting. It should be launching soon. And we're now involved in the trial of the aficamten as well. That should be launching any day now at our institution to give options to patients.
There might be some news coming later today on that topic.
Oh, that's great.
You want to stay tuned.
Okay, awesome. And then, I just talked to Springer about starting the 3rd edition of the textbook. It'll probably be the same number of chapters, just updates. I'll probably mix up the authors a little bit more this time. There's been a lot of new players in the field. I'll probably talk to you, Lisa, about who to get more involved. Because, with anything else, some people are less involved in the field and people are now up and coming in the field. And the textbook is educational, but it's also an opportunity to give people, some segue into the field and to really stake a claim to the field. So I'm eager to do that. A lot of new names that really weren't even involved as much 5 years ago. So at our program, I think, what we've tried to do is put together a program that has, quote unquote, everything under one roof, including a large catchment area of patients that can really just come see us within an hour, essentially. So, I put together these 16 things that an HCM program should have. It's a lot of stuff, but I think that we have all 16, and I spent a lot of time trying to make sure that each of these areas become autonomous, meaning that I'm the quarterback, but we have good people in all these areas that I can really trust. In other words, if I need a pacemaker done, I send them to our HCM EP physicians. They know how to put a pacemaker in an HCM patient. They know the complications. They know the lifespan of these devices in them. They know the worries, and they know how to program them efficiently without inappropriate shocks and this and that. So it's very important that each of these things are not just present at your institution, but really micromanaged so that they're really at the highest level. And I know you know this, but I think I'm just trying to show that really we spend a lot of time making sure that every area of this is really cutting edge and moving in the direction where outcomes are high, consistent with low complication rates for our patients. I highlighted the areas that most programs don't really have much. They either don't have a pediatric hospital that can do the EP in pediatrics or surgery in kids, alcohol ablation or myectomy. A lot of places have one or the other, but not both, at more than 10 to 20 per year. We have a heavy heart failure transplant program, doing about 30 to 40 transplants a year. So that helps our patients who get to that end stage, including ventricular assist devices, advanced stress testing, genetic counseling through dedicated counselors, and obviously the clinical consultation and follow-up. I put down some key tenets that I think are differentiators in our program. One being that we have two offices, one in Long Island and one in Westchester, and our whole staff goes to Westchester and goes to Long Island on different days so that our patients don't have to travel as much. And each of these offices can do pacemaker interrogations, echo, stress testing. We have 2 nurse practitioners, 2 coordinators, and now we have a fellow rotating on the HCM service. All of our 6 advanced fellows are now mandated to be part of the HCM rotation, which I think is wonderful. They see inpatients and outpatients, and they learn HCM care prior to graduating their fellowship here. We have I think number 2 is very key. We have a dedicated team that's knowledgeable on HCM that answers the call. So when patients call, they get only an HCM phone. They only get Mallory or Carolyn or Nicole. They get these 3 people no matter what, off hours, on hours, holidays or not. It only goes to them. It doesn't go to the regular answering service, which means that they know the 3 people who are going to answer the phone. Those people know about HCM. They can handle most things, and then they can titrate up to the NPs, clinical issues like if they admitted to another hospital or whatnot, and then goes up to me if there's something that needs that level. This allows us, I think, uniquely to be both the primary and the specialist for our patients. Because we have such a large catchment area, our patients keep us in the loop on everything. And I think it's unique because some programs they have to fly out to, and then when they're not there, most of the stuff is happening with the primary cardiologist, and the specialist may not know what's going on. I really pride myself on knowing what's going on with our patients because we're just so easy to access and we're within driving distance of them. It's not to say we don't work with our primary cardiologists well, we do quite well, but I think they're also happy that we're so involved in the care of these patients. Another programmatic aspect of our center is that we have organized relationships with all the hospitals, meaning even hospitals that don't send to us routinely are not part of our network, like the North Shores or the St. Francis or the Stony Brooks or the LIJs or up here, White Plains and other places. I have people at all those hospitals who take care of my patients when they're there. So if a patient gets admitted, I know who to talk to go see my patient. And if there's something that needs to be escalated, they'll help organize a transfer to our hospital. So that I think is something that has evolved over time because otherwise you lose control of those patients and then they get poor care, as you know. We spend a lot of our time trying to handle patients at other hospitals who do all the mistakes that we try to avoid as centers of excellence. And then finally, since we do a high volume of myectomy and alcohol ablation, as well as advanced heart failure and bailout strategies for some of these patients who really get end stage heart failure, and because of the clinical trials, I think those are areas that we're moving into in our program. These are the 3 areas that you've probably seen the slide, Lisa, that I think define a center of excellence. And I try to keep Westchester Medical Center overlapping all these things. You should have comprehensive multidisciplinary team, all diagnostic and treatment modes available under one roof, coordination of care and ease of access for the patient, then a large volume of patients in your catchment area in both pediatric and adult and all phenotypes. And finally, I think the national presence and the lectures and the education are very important because, as you just heard from the other speaker, moving forward is very important and making sure that you're always at the cutting edge and really trying to spread the word about HCM like we're doing today. And the strengths of our program, again, are the 2 locations, the 2 coordinators, 2 NPs. We do the most number of alcohol ablations in the country right now. Myectomy is about 20 to 25 a year, depending. COVID has been tough in that regard. Advanced heart failure, genetics, pediatrics, the training courses, I'll show you the guidelines and the national prevalence. I published this a few years ago. This is outlining all the different hospitals that do alcohol ablation. We were the highest at that time, followed by all these other hospitals. Probably need to update this as well. We did this training course starting in 2014. We did 5 of them, and then COVID, we bailed on 2020 and 2021 because of COVID. So I'm gonna have to figure out with you, Lisa, and others, what we do with this. In the meantime, I've gone around and helped proctor places, as you know, and talked to you about which places really warrant that level of teaching and expertise. These are the two textbooks. I will say in the past couple of years, and I don't know if you saw this when you were here, Lisa, I think this is new, the new ambulatory pavilion. This whole glass building here is our you did see it? Is our outpatient facility. And it's really been amazing, honestly. I didn't realize how much of a benefit it is to our patients and also our sense of well-being and practicing. Our office is beautiful, huge rooms, all the capabilities. And then one flight up is the cath labs as well as the recovery areas for patients. So one thing nice, especially during COVID, is patients will be able to come in through a separate entrance with different protocols, keeps them safer from the main hospital. They all have individual rooms and easy to social distance, and has been able to have a very seamless patient care for these patients to come into the ambulatory pavilion, get their procedures, be it TEE or echo or cath or stress testing or MRI, and then get out, relatively quickly and very efficiently in a very healthy environment. So that's been a real boon to us. I certainly underestimated how good and how important a new building is. I will highlight our team. First and foremost is Dr. Panza, you see on the top left here. He's my chief of cardiology. But part of the reason I came here, as you know, is because he's had if I've had a 20-year history in HCM, he's had a 40-year history in HCM. He worked with Dr. Marin and others at the NIH, and he has a lifelong commitment to this disease. And he also sees patients with me. So he sees some of the patients with HCM, and I see the majority of the patients with HCM, but we have similar styles in terms of how we take care of our patients and prioritize them. I think Lindsay Davis here. She was here for a day.
She'll be on later today.
That's great. And so this is our offices. And so she spent some time. This is our outpatient office. I don't know who this person is.
She had prednisone. You shouldn't be showing that picture anyway.
Okay, I can compress it later for you.
What's that? That was May?
That was 2016, 17.
Oh, it'd be like May of 2017. I'm
right after your
prednisone
right after your transplant. So this is this is the team on Long Island for the opening, and I'll highlight the way I do these things. I have patients here. These are some of our patients, some of our staff. This is my dad. This is our echo lead tech. Obviously my chief, some of the electrophysiologists, non-invasive cardiologist, another patient. Nope, actually. And then Lisa, another patient's husband, actually. And then Lisa, there you are. And then this is the cath lab team. So, really it's a team sport. And I think one of the things I missed at my old hospital that I was able to get at Westchester here was have all these people together. I think our attitude is also, I think that our attitude is very friendly and happy. These are pictures that we've had at our office. They were for internal use. It's the first time I'm sparing them externally because this was actually during my birthday. We did all these cupcakes. And I don't know who we're taking the picture for, but I guess it turns out to be this. And then this is our lead echo tech and our IT and our cath lab and invasive operations director. And then again, I want to thank our patients. These are some of the patient stories we've had over the years, but it is true that we do learn from our patients. And I think one thing that we don't talk about that goes into the experience and the expertise is really seeing so many patients and starting to get some pattern recognition. And that takes about 10 years, but then eventually things just smell wrong or smell like something, and you kind of have a sixth sense about what's going on with the patient. And that I'm very grateful that we're at that stage here. Who's this person?
That's an old picture.
This is when we did the textbook or something. And yes, this is my Facebook name, but I like this picture because this characterizes our relationship. Me being crazy and you being like, what is this guy talking about?
I am rolling my eyes there. It does appear.
Exactly. This is a 20-year relationship. It's pretty obvious. I think we've worked well together, Lisa. I think on the textbook, and I think together, these are some of the programs that I visited and helped start their program. Some of them came on the calls today. I know Rochester was here, but I really, in retrospect, I'm really, some of the things that I really have enjoyed is feeling like I have had some say in developing programs. So I get a little sense of what you've been doing for the past 15, 20 years too. There's a lot of pride in that. And I think, you've done a lot. I've done only these, like 6 or 7, but it's been a lot of fun to do that. So I do want to end one last slide. I'm thanking everybody. The team is huge. It's actually grown since last you saw Lisa. So I have to update to you. We have 2 NPs. Dominica is a very experienced NP who's been in practice for more than 20 years. She has joined our practice and working more with Dr. Panza, but covers Carolyn. So I have to get her on the list. We have other people in imaging, EP. We've had Dr. Pan. I'm not sure he's on. I got to bring him up to speed with you. He's our specialist in amyloid and sarcoid. That's primarily what he does, and he's heart failure. But it's been really great because I was seeing a lot of the amyloid patients, and now when they come to me, I send them to him, and he does the biopsies. He does everything. So he's been amazing. You'll like him. And the rest, I think you see here, we are hiring a new pediatric cardiothoracic surgeon. We just hired them, so I'm going to contact you to get that person on the list. And that's kind of it. So I'm going to stop sharing, and we can chat for a bit or whatever.
Oh, we got a couple minutes. We're doing like fast. This is like speed dating HCM style.
I know you are.
So it's State of the Union. It's rah-rah day. It's everything. So I do have to laugh. So you go back and you say, okay, first memories of working with somebody or getting to know them.
Oh, let's hear it.
ACC. The booth was back in a corner because I didn't get good spots back then. And this young guy comes up to the booth. I'm going to do HCM. You're going to do HCM, are you? Okay, what are we going to do to it? And I got all these great ideas like shot out of a cannon. And I'm like, whoa, slow your roll. And I'm like, we talked a little bit. And then I had to go off to a session. I'm like, okay, I have to go now. And I leave and he's still there. And he walked with me the whole way. And he talked the whole way. I'm like, this guy might actually talk more than me. I'm not sure.
I'm from New York. You're from Jersey.
So there is a little bit of a East Coast theme here today. And I forgot to mention this to Sara Saberi when she was on earlier, because she was saying how much she liked working with Charlene Day. I'm like, Jersey girl, Matt Martinez, Long Island, New York, New Jersey. Maybe you need a little bit of that attitude to survive in the early days.
That's the energy, yeah.
So it's been great evolving and moving forward. We have some other things I'm not quite ready to announce yet that we're going to be working on, but by next HCM Awareness Day, I suspect that we'll have some other stuff to talk about, but we'll talk about that offline. So when I say like there's a lot of things happening in the HCM world, people, it's busy. There's a lot going on and it's all good. It's all
No, it's great. I mean, we never had this many different approaches, like different people interested in the field. But it is good because we struggled for so long with nobody interested other than us and our patients. And you started that. And so it's actually a breath of fresh air because we're not in this alone as much, which is good.
We are so not alone. We have so many wonderful partners, other organizations, industry, centers, just medical systems. All are understanding why not be smarter consumers of healthcare? Why not let experts guide the care? Why not take the lead from the experts who have already figured out the science? Let's be smarter. And we're doing this together. So that's pretty amazing. And it's really nice being a 26-year overnight success.
Yeah, right.
Where people are like, oh, well, we should do this, the other thing. I'm like, I've been here for 26 years. We tried that, didn't work. We're doing this now. Follow me, trust me. Right. And now we're building out more committees at the HCMA. We have more projects. We have more services that are very, very, what's the word I'm looking for? Perfected. I mean, it never gets to perfection, but we're perfecting systems. And it's not just Lisa on the other end of the phone with an assistant. We have a team of 10 here now. Yeah. And then we have all of our volunteers and committees.
I think that's been huge, Lisa. Over the years, it's been so nice to be able to tell a patient that they can call your offices because it's a third party, somebody who cares about the patient and can put things in context, and who, it really helps them a lot. And so that's been really helpful for patients if they have questions.
Okay, well, Hari, I'm going to let you pivot out now. And we're actually going to stop streaming on Facebook right now, but we're going to be back at the top of the hour on Facebook. The webinar continues. So if you're in the webinar, stay here. Hari, thanks.
Okay, good luck.
If you're in the webinar, continue. Facebook, I'm going to stop feeding for a few minutes because we're going to come back at the top of the hour with none other than Dr. Barry J. Marin. And for right now, we're going to do a pre-recorded message from our friend Lubna Choudhury at Northwestern while I take a quick break while that is playing. And thank you, Facebook. We'll be back later.